I'm calling the meeting to order at 1:05 today. Would you please call the roll?
Yes, Cavell will be here soon. Cobalt,
Here.
McGillivray,
Here.
Howell, we don't know. Commissioner Charles, we know, is joining us online.
Right?
Good day.
Hi.
In present.
Long?
Oh, I'm in
Here.
Southfield as well.
Thank
Sorry
you.
about the delay.
Oh, yeah.
Long?
Did you hear?
Yes, Commissioner Charles. Moss?
Here.
Mark?
Here.
You have one?
All right, thank you. Let's stand for the Pledge of Allegiance.
I'll stand for
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So this meeting of the Board of Commissioners is specifically for budget hearings. Today, our first group is Health and Human Services. Welcome.
Thank you.
Yeah, so basically, what we've been doing is you just tell us what you want to tell us, make your presentation, and then I'll open the floor up to the commissioners to ask any questions. It's hopefully gonna be just a friendly back and forth. Our goal is to help you tell us what your budget looks like and how it's been going, so.
Okay, great. Thanks for having us. So Leanne Stafford, Director of Health and Human Services, and I will let the two individuals with me, these amazing people, introduce themselves. So you want to?
I'll start.
Okay.
Shane Buys, Manager, Neighborhood Housing Development Division.
Calandra Green, Public Health Officer for the Health Division.
And then we also have on the phone Stacy Smith, which is our Administrator of Fiscal Services for the Health Division. And she also interacts with Shane too over at Housing. And then we also have with us Mr. Scott for MSUE. We're going to talk about some changes that are happening in the budget, but we wanted to bring him along just in case you had some
One of my
additional questions.
Right here.
Okay, we're going to talk through it. So we're just going to, yeah, come on over. Yeah, quickly, just walk through what our KPIs, our key performance indicators are for health and neighborhood and housing development.
I'm gonna ask you to bring the mics up
okay.
real close. I have been told that we want to make sure everybody can hear everybody and,
Is this better?
yep.
Okay, perfect. So you can see this has been a process, right, that we have worked on for the last couple of years. We each kind of have our teams that are centered either in health or neighborhood housing and development. So you can see in health here, you know, what we do in health is we really try to look at the lifespan of a person, right? So we start early, even as prior to someone, you know, maybe having a baby, to, you know, through the antepartum and postpartum, right? And then how does that baby do in their first year of life? Then we do childhood, young adult, all the way to adults and seniors. And so what you'll see as you look through our KPIs and our actually service level KPIs is really focusing on all those areas. So you can see these are our KPIs for health. And the other part that we really tried to focus on when we were developing these is how do they connect with the Oakland County strategic framework priorities and goals as well. So you can see here on the slide, under each of our health division KPIs, which are under the numbers, we connected each one of those, except for the last one, to those OC priorities as well and goals. So, you know, a lot of them are focused on our priority projects, whether it would be our, you know, NFP project, which is all about first-time moms, to our WIC, which is all about, you know, how once a child is born, how do we get their nutrition and the education to their parents to where we need to be up to year 5. You know, how do we get people into routine checkups when they need them, so that if there is an access issue or a funding, you know, issue, how do we get them in, and so that they see someone, you know, annually or as needed. And then also looking at food insecurity, we're doing a lot of this across the department. Shane's team is focusing on that. Yes, health team is focusing on this, so we're really doing this department-wide. And then one important piece is, really working around elevated children's blood levels and really looking at their lead levels. And so working on programs to try to not only reduce, but also just get every child the necessary screening at an early age to see where they stand. So that's what these health kind of KPIs are now. We also, the next screen, you don't want to go back to that. Got one more, sorry. This is kind of some of the data that we'll be looking at. So we try to pull, data to look across not just an individual indicator, but the disparity in maybe an indicator. And so you can see here, we're not just looking at we're looking at all mothers, but we're also looking at how it's, how it's impacted based on race. And you can see here, percentage of Black mothers with prenatal care in first trimester. It's significantly reduced compared to all mothers. And so what Calandra and her team does is we try to wrap the services in the community around this initiative. So we know Health Division, we can't do it alone, right? So who are the partners that we can bring in to help impact this level? And how do we get it to a closer gap or even, reduce those levels? And so that's really the focus around a lot of our programs. I think health does this very well. We have a lot of data. What we don't do as well is kind of talk about it, right? We don't, maybe we don't have indicators that we're showing on websites, but it is something we have a lot of and that we look to utilize to modify our program. So we have a lot of mandated programs and grants that require us to do certain things, but what we really do is we look at the data, what does it say to us, and how do we need to adapt our services for the community. And so I think it's something we do very well, and we're continuing to do better. So here, service level KPIs, again, a lot of mandated services in the Health Division, a lot of grant programs, but you can see in all, we have 101, let's go to the next slide, sorry, 101 service level KPIs that we're monitoring. So we took each of our services, and each of those services, we said, how much of each of these are we doing? So we're going to be displaying that on a dashboard for people to see. How well are we doing it? If there's a performance measure we're trying to meet, how is it going over time? Is anyone better off? Is this service something that's really helping people in the community? And if not, then we're going to look at ways to make changes. And so that's what you're going to be seeing as part of the KPIs in the Health Division. So this is our housing, our neighborhood and housing development. And Shane's going to help me with this piece because I've been less involved, so I'm going to let him take over here on this one. You want to go ahead?
Yeah, you bet. So the KPIs you have before you, Neighborhood Housing Development Division. If you look at all those, our challenge in our division when we were designing our key performance indicators were those metrics that were available, easy to get, and what outcome metrics that maybe we are not currently collecting, but we want to start collecting and getting information on that. And some of these we have more control over than others. For example, percent of our housing counseling clients who meet their housing goals. We have more control over that than, say, for example, number of refugees settled in Oakland County. Why might our division be responsible for that? It's because we work on the livable neighborhoods goal that has some food assistance and some refugee assistance part of that as well. Our community liaison is heavily involved in those conversations. But although we might not have direct control over the number of refugees that settle in Oakland County, I think it's important that why or why not are refugees deciding to settle in Oakland County, that invites a broader conversation that we can then talk about, well, where is that control? What are our goals? That kind of a thing. So our KPIs, unlike health, has a mix of indirect and direct control, but these are all very valuable conversations to be getting as we move on with our strategic planning.
All right, next slide.
All right. And some of our service level KPIs, For example, Affordable Housing Development, Housing Trust Fund, we're standing that up right now. We currently have the manager and coordinator positions posted online. Those are part-time positions. We're currently looking for those. And these all generally follow our services that we have available. Now, as you can see, we're a smaller division. We have, less services that we concentrate on. Community development, that's where a lot of our community development block grants go to the communities themselves, where they decide what they want to do and they implement those funds. We have our own home improvement program, but we also assist other local agencies with some of their home improvement efforts too that they use funding for. And same thing for homeless agency support. And again, we have emergency solution grant funding that goes to support those agencies, and we have our own housing counseling. So smaller number of services, smaller division, makes sense, and those are the ones that we're focusing on.
All right. Want to talk a little bit about new investments?
I'll just keep going then.
Okay.
So this is new general fund investment. Last spring, we came and we had a conversation about establishing that framework for the Housing Trust Fund with an annual general fund investment, in addition to some regular ARPA funding, one-time ARPA funding that's going to be managed by the Housing Trust Fund as well. And again, this goes to directly helping to move the needle, move the metric on percentage of people who spend more than 30% on their housing costs and needs. And that is the general broad nationwide metric as far as what housing burden is. 30% of your gross income. If you spend more than that, you're considered housing burden. Now, if you get down to any individual situation, maybe 29% is housing burden, depending upon the situations. Maybe somebody who's 31%, goes to their housing costs, really isn't that housing burden. It all kind of depends upon somebody's individual situation. But as far as a broad metric across the entire nation, this is the standard. This is what all agencies measure and compare by. Key budget changes.
Yes. Okay, so this is a couple things we just wanted to talk through is in the health division, we are deleting 2 vacant PT&E positions. So these are positions that are not needed any longer, and so they are vacant, so we are taking those out of our budget. But a big change in Health and Human Services is really around our MSUE division. And so what we're looking to do here is the changes are only happening. We're not getting rid of MSUE. They're still going to be a great partner of the counties. Ed and I have become very good partners. Is we're just changing how we're funding positions for MSUE. So we're going to continue to provide some operational costs. We're still going to help them with some of their phone system, and we're going to continue to offer them space here at the county where they'll continue to offer their services. What we're doing is we're deleting 5 county-funded positions, and we're giving them the funding for those positions in our professional services contract. So what ended up happening is over the last couple of years, and this is where Ed needs to jump in, is the programs have changed how they offer their services. The applications that we utilize at MSUE are actually MSU applications. So our employees are not even operating or maybe assisting, but they're not entering into county-funded systems, applications. Even credit card machines, even cash machines, cash registers, they're all MSUE. So we thought with the new contract, because we have to do a new contract, it was the best time to give them the funding to be able to hire the positions with MSUE. And actually is a bit of a savings for the county to do it in this direction because our county positions actually make a little bit more than when they hire them in at MSUE. So the 5 positions that we're deleting, because I know everyone, those employees are not going away. They actually have homes. We have positions for them in the health division. So knowing this transition was going to happen, we kept vacant positions vacant, thank you, Calandra, so that those MSU employees, county-funded employees, would be able to go into those positions. So
And I can, is my microphone on? Okay, I can just maybe share a little bit more of the history. We've been in a position for a number of years, probably close to a decade, where we have had several individuals who were county-employed individuals working in our office. And as positions have been vacated through retirement or people moving on to other opportunities, we've sought the funds for those positions to transition those over into MSU extension positions. It just makes it simpler for purposes of supervision, for the programming and applications that we use. And so through some conversation, as we came to the end of the current 5-year contract that we're in, as we were preparing a new contract, and also because of the changes that we had gone through during, COVID-19 and us changing fundamentally the way that we work and interact with office spaces, although in most ways we're sort of back to normal now. We looked at this as a good opportunity to sort of rip the Band-Aid off, and we looked for ways, first of all, it was a priority for me that nobody end up without a position, right? We wanted to make sure everyone had a place to land. But also we looked for ways to make sure that this was budget neutral. And in fact, I think we're coming out on the positive.
Okay. Commissioner Moss?
Thank you, sir. So you are basically working with Michigan State University. You are.
Yes, that's correct. I'm an MSU employee.
I would expect no less. You're wearing green and white.
Yes, sir.
So I just to be sure, in this case, MSU Extension is essentially an outside contractee with the county, and we are deleting county positions to fund an outside vendor contractor. There, that sounds good. To do those services, you're essentially outsourcing it.
In a way, yes, yeah. So they'll still offer Oakland County. It's like the Gypsy Moth program that you all contract with MSUE, right? Same idea. They'll be doing the work for Oakland County. It'll just be a contracted position, correct?
Good. And in terms of full disclosure, I'm a graduate of Michigan State University.
Go green.
Go white.
Commissioner Gershenson, which, by the way, she has joined the table as an ex officio member of the committee.
Okay.
And I, for sure, am a big supporter of the health department, so I wanted to be here. But I'm also a big supporter of Mr. Scott and MSU Extension, and I've worked extensively with the extension. So I just want to be sure I understand this change, that there are still, your contract is still going to be with MSU?
Yes.
And one other person? No.
No. So the way that Oakland County and MSU have been in relationship and in partnership is
Right.
through the professional services contract process.
Where we've contracted for all their employees.
Correct. We were doing more employees prior to. Now we're just taking these additional employees and making them all MSU. So there had already been some transition before. So we
Right.
had 3 employees prior to this that were Oakland County employees. And we took and we made them MSUE, paid MSUE as part of the professional services contract. So now the remainder of the positions that are county-funded positions, will be deleting those and giving them the money to hire as MSUE employees.
So where does someone like Robin Dantow fall?
Great example. So Robin is actually going to become a member of the Health Division. So Robin is a health educator. In the Health Division, she would be called a health educator. So she will be joining our health education unit in the Health Division, doing many of the same things she's already doing, working with seniors. She's going to be working with ECHO, which she does now, Senior Project Fresh, HOP. She's a big member of HOP. She will continue to do those, but she'll be in the Health Division doing those things, so.
Okay, well, I just wanted to say how much we enjoyed working with Ed and Terry Gibb on the Gypsy Moth project with Commissioner Spiz, and then being able to refer the Farmington Hills deer study to you to give advice on. That was very helpful. But I really want to call out Robin Dantow, because the work that she's done with MSU Extension, with the HOP committee through MSU Extension has been, she's one of a kind. And I certainly hope that her responsibilities stay and that we don't lose her on the Healthy Oakland Partnership Committee.
She will continue to serve on that.
She will stay on board.
Correct.
Thank you.
Okay. Do you have more you want to add?
Well, just a couple of things we wanted to talk through, some of our initiatives where you see a lot of our maybe funding coming or going to. So obviously, the Housing Trust Fund, if you want to maybe ask some questions after, but I think at this point, you all have kind of gone through that. So response to public health emergencies, this has been a big one.
We
For
don't
the
have
last-
any of those around here.
For the last 6 years, I say, poor Calandra, I don't say poor Calandra, but she came in and she's been hit with, really COVID and then monkeypox, and we're watching many things across the board as they come, but that has to be one of our number one priorities. And so even flu, right? Watching for flu every year and how we respond to that. Increasing vaccination rates. If Calandra wants to kind of expand on this, but just basically since COVID and some of the distrust in vaccines, we've seen a significant dip in vaccination rates in kids. And this is very, scary, and that just shows New York, New York recently had, has a scare that we're watching very closely for polio, an eradicated disease. So do you want to maybe touch on this a little bit
Sure.
more?
Where would you like me to start?
Yeah. They can ask questions, but just a few things if you
Sure.
want to talk about what we're doing.
I think that most importantly, we've been talking about the lifespan, and so infant mortality is certainly one of the things that we are watching very closely.
Her mic is a little soft.
I hope this is a little bit better.
Is the green light
Is
on?
it? Yeah. I don't know if I push it, will it go higher?
No.
Oh, okay, I'll stop pushing
As long
buttons
as
then. So infant mortality is something that's really been on the radar as we look at the lifespan. We're very proud of the programs that we currently have in place at the Health Division, and we're expanding upon those programs to look at pregnant mothers and follow them all the way through 3 years of life through multiple programs through Oakland County, through the Health Division. We still are seeing a significant reduction or increase in infant mortality when you look at us as Prosperity Region 10, which includes Detroit, Macomb, and Oakland. But if you were to pull out Oakland County is actually doing better than the state in terms of infant mortality rates. But if you dive a little bit deeper and you pull out Southville and you pull out Pontiac, there's still a lot of opportunity for us to prevent these deaths in our infants. And so that's something that has really been on the horizon. We've been trying to get more out in the community and talking and working with our community centers, because we know a lot of our seniors are raising their grandkids and great-grandkids. We've been getting that message out with our pastors in both the Pontiac and the Southville area to talk about how they can take advantage of these free programs to have a nurse. Most recently, we're working with the organization called Black Mothers Breastfeeding Association. They are looking to provide doula training in the city of Pontiac to kind of mirror what they're doing in the city of Detroit. That program was pushed to January, but I was just out last night talking with one of the churches, and the mayor was there as well, and I was able to put a plug in a little bit for the doula training. And I had two people that I know in the city of Pontiac. One I went to school with, one I used to work for me in the hospital system as a LPN. So we know that there is urgency. We know that there is a need out there. We know that people are very interested in infant mortality when it comes to dealing with African and Hispanic populations to increase those rates. I think we have great opportunities to improve those numbers and prevent those deaths from occurring. As it relates to communicable disease, I thought that we were really moving in the right direction as in terms of COVID, but COVID is still around. COVID is milder for folks that have been vaccinated, and vaccine is widely available for folks that want it. We've been spending really the summer working with the CDC in the state and talking about processes and strategies for vaccine hesitancy that we're seeing. Oakland County did fairly well when we look at our age groups. What we can see right now is that that 6 month through 4 years, which is the newest vaccine availability for the younger children and babies, that we're really not seeing a whole lot of vaccine. Oakland County itself has done about 7% of the eligible population. That does not include those that are being vaccinated through their pediatrician's offices and other clinical providers, but we're seeing very low numbers, as we did see in the 5 to 11 age group as well. We saw about 43% of that population being vaccinated. That's really concerning to me because kids are getting ready to go back to school. They're going to be back in close quarters again. They're going to be switching in multiple classrooms. And we know that the CDC, as well as the state, has dropped a lot of those restrictions. Actually, there are no restrictions anymore. And so it's important for us to continue doing some of the efforts that we've done before, which is having that relationship with our 28 school districts and making sure that we provide good guidance to schools as they enter back into the classrooms. So communicable disease is one of the things that is really on our radar to make sure that we are providing good guidance, sound guidance that are going to help schools and prepare their emergency plans as they go back into the classroom, and also continue that relationship with school board presidents as we've done over the last 2 years. So. Polio, Leanne mentioned polio. We haven't heard about that since sometime in the 70s. This is a communicable disease that has been eradicated, and now we're starting to see that again. We're already wrapping our arms around that and making sure that we are putting information out. We have done a lot of vaccine clinics in our communities all across the county. We stopped and shifted from providing COVID vaccine and having a single focus to having a multi-focus. And when we go out to any clinics, we bring all presentations of those vaccines. We look at it as the whole community, again, that lifespan. So if it's the child that's going to be vaccinated because they're going to school, we're also asking the questions of who do you have with you today? Do you have mom and dad, grandma with you? And we look them up as well and provide their vaccine as well, anything that they're missing. Again, targeted messaging to get people to really, again, trust in these vaccines and deal with that hesitancy issue. It's a hard nut to crack, and I think every community is different in how they view it. And some of what we need to do is prepare targeted messaging for our audiences that we're trying to serve. So that's some of the things that we have and some of the strategies that we plan to use to move forward. What questions do you have for me?
Commissioner Moss has a question.
I got a couple.
Yeah.
Let's talk about talk about health. You're talking about monkeypox. This reminds me of this is starting to remind me of 40 years ago, where there's a strange new disease a gay men are getting, and I don't like it one little bit. But thank God people aren't dying from it, which thank God. But this this sounds to me very horribly familiar. What is the Oakland County Public Health doing about communicating how you get it, how you keep from getting it, and getting it to the right people? Because we wasted too much time in the 80s monkeying, screwing around until the thing actually became horrible. So how are we trying to nip this in the bud?
Yeah, absolutely. That's a great question. And I think that we're taking a tiered approach. And so, one, let me preface it by saying that this illness is typically what we're seeing, it is in the MSM community, which is men report having sex with men. All of the cases that we have seen in Oakland County, which we have 17 cases for our county, which matches Detroit, they have 17 cases as well, and that was as of Friday. All of these cases have been male and men who report having sex with men. That is not to stigmatize any group at all. It's just what we're seeing, and so we need to be able to share that data. One of the things that we've done is we've started a task force. So Oakland County Health Division created a task force. We're working with the folks at Affirmations, who we already have a connection with, Dr. Benson, who oversees the Be Well Clinic, who also oversees, who prescribes PrEP for individuals that have reported MSM. We designed clinics in which we are offering monkeypox vaccines at our health division 5 days a week, and we're also out at Affirmations, which is in the center of Royal Oak, Ferndale area, and we're out there providing vaccine as well. Our task force includes state representatives as well, so Dr. Beck Desarian, who is the chief at the state level, sits on our task force, as well as other community partners, including some emergency room physicians as well. The hard part of this is that the vaccine came from the Strategic National Stockpile. So this vaccine is not currently in production, being produced. We are working with both state and federal partners to really talk about the urgency in producing this vaccine so that we can eradicate this and really contain the spread of it. To date, we became a hub. Oakland County serves as one of 5 hubs across the county to receive and redistribute vaccine for those individuals who need vaccine. It could be clinical partners, and right now, that's the only people that are actually providing Jenios, which is the vaccine for monkeypox. Initially, we started out with messaging from the state that Jenios was a 2-dose series giving 28 days apart, and they asked for us to do a delayed vaccine administration, meaning we gave 1 dose, and then the second dose will be given when more vaccine was widely available. We have gotten over 1,000 doses of Jenios since the beginning of this, I wouldn't call it a surge, but since our first case in Oakland County. We have put over 800 shots in arms for those that identify with MSM or have high risk factors where they have been at a known geological location where having multiple sex partners has been identified. We don't ask people to attest to any of these things. If they meet one of those criteria, we're vaccinating them. We have just set up a GIS map. When we look at our numbers, we're not only vaccinating people in Oakland County, but this information through this group travels very fast. And so we've had people come from Canada to get vaccinated because vaccine is not available there. We've vaccinated people in counties outside of Oakland County. I would say that Oakland County is a front runner just because of my communications with folks at the state level and the other hubs who have vaccine, that we are ahead of what everyone else is doing in terms of our strategies to contain the spread of this. Now the CDC has come out with a recommendation that this vaccine can now be changed from a subcutaneous, which is given it in the fatty part of the arm, not in the muscle like we do with COVID, and we can give it intradermal. So if you've ever gotten a TB shot, it goes right underneath the skin layer, the surface layer. And so that is going to expand and extend our amount to vaccinate multiple people. So you take 1 vial that we were given as a sub-Q, and you can split that now between 5 people. And so we have a task force meeting that meets bi-weekly, and we are very serious about being in the community. Our next steps, of course, are the state has planned to extend who should be vaccinated. But we haven't seen any cases. What we need to be concerned about now is congregate settings, and so we're working with the jail. We've created some eligibility for criteria for the jail as well. We have provided vaccine to them, so for anybody who can identify within our jail systems, they can be vaccinated. We're also going to be looking at long-term care facilities, child care centers and daycares, and also colleges, universities, and K-12 schools. We are working, I'm working a part of a task force with the state to develop the toolkit and materials that will go out and be disseminated to all those various groups on how and what our response will be to monkeypox for those areas. Right now, it is contained with the MSM, but we're not going to wait for it to happen in a child or someone in a long-term care facility. So we're currently developing that material.
And one thing, it has in other areas, I think there's 7 kids in the U.S. that have, they've been diagnosed with monkeypox at this time. We have not seen any in Oakland, so.
Right, because
Before we go on, I just want to be mindful of time. So you guys are supposed to be here till about 1:45.
Okay.
So we want to make sure we keep our questions, and if you have anything else you want to share with us too, we want to get that in. So go
And
ahead.
just cut me off at any time. I tend to go on and on because I'm very passionate about it. So.
well, yeah.
Commissioner Moss.
Well, yeah, because if we can nip this thing in the bud, the playbook, if you will, is still all there, and it took until 87, 88 to really get going and get past all the crap in dealing with AIDS, and a lot of people died in the meantime. People we know. So I would like to, whatever your urgency is, if you don't mind, I'd say double it. Now let's go to polio. I belong to Rotary, and 3 or 4 years ago, it was like, we got it basically eradicated, except in way in Afghanistan and Pakistan and northern Nigeria, and it's like, it's just a matter of time. Now you've got it in New York. For God's sake, do we know how that happened, number one? And number two, what are we doing about it? And what are we doing here to keep it from coming here?
Yeah, so I know I was on vacation and I saw the article come in about New York, and we quickly jumped on communications, right? So we were watching how measles, right, came to how we got our first case in Michigan. And so the partners that we gained in measles, we utilized those same partners, and we started communicating immediately in those communities, right? So Kate Guzman is our administrator over medical services. She has amazing partners in the community. We started working with Hatzalah in one of our Jewish communities in Oak Park, and also in Southfield. And we started talking about what we needed to do. Let's start encouraging people to make sure they're updated on their vaccines, right? If they weren't sure, how do we get them vaccinated? And so we jumped, as soon as that first case came out, we understand the urgency of these at this point because we saw how quickly COVID went. And so we really focus on our partnerships that we've gained over, and we start talking about that. And so we have. And she has really been focused on that initiative. And so we are closely watching it. We have amazing epidemiologists that watch this very closely and work with us on how we can move forward if we need to. At this point, we're watching and preparing. So.
Thank you. And just one more. This is deep into the line items. I noticed that travel and conferences and things, you're kind of seem to be getting rid of those. This doesn't seem to be a good time to be turning inward. I would, if it's just my own 2 cents worth, I would be going to more and more and more conferences and things just to be able to get your hands around what is going on and what other people are doing, because these things popping up. I don't like them. They are particularly the monkeypox is quite scary. If you remember AIDS and polio. I mean, seriously. So, you're not just human services.
Right.
You're also health.
Yeah. So I think if I can respond to that really quick across the board is. Many options are offered virtually now, right? We're seeing a lot of it. So that really reduces what the cost of a conference will be. You don't have to travel, you don't have the hotel. So really we looked across the board, knowing we needed to cut, right, at some places, and still allowed a lot of opportunity where people can go, and really focusing on virtual because, again, traveling, you have a larger exposure of getting COVID, right? And that takes them out of the workforce. And so we still allow for that type of travel, but we really have tried to pull it back a little
Not
bit.
as
Yeah.
many in-person
Yeah,
offerings
there's just not
by those presenting
Right.
agencies.
I see Commissioner Charles has a question. She's online. So can we?
Thanks, yes. And I'm also using the hand raise in the Civic Clerk, FYI. So I'm looking forward to the launch of your dashboard. You spoke of that. What's the timeline looking for? That's question one. My next observation is to Mr. I'm missing my name tags now, Mr. Moss's point about many things that you do. I think it's also important to know beyond just human services is like you're involved in air, beaches, for some reason body art, campground inspection, classes, food safety, sewage disposal and septic shelter programs, swimming pools, well and water services. That's a ton right there. And what's a little concerning is that for the first time in a long time, your numbers are below 457 people in personnel. And so when we think about like food safety, which is one of the things when people say, well, what does the county do? One of my first things is like food safety folks. Can you speak to that just in terms of, do you have enough support in that area to keep us all healthy and safe when we're eating in these establishments? And in closing, I just appreciate your Facebook and Twitter pages are both very vibrant and alive and relevant and timely. So that's my comments and question.
About staffing, or you want me to?
Yeah.
Okay, so I am going to talk about dashboard first. That's a county, the county is going to launch the dashboard, and so we will be participating in that with the service level KPIs and be able to provide that information in those service level KPIs. Food service across the board, we have utilized for COVID, and we do have some funding this year that allows us to really focus on all communicable diseases. We have used contracted staff. It's easy to bring them in from maybe 5 months, right? Because it might be a short-term focus. We did this a lot with COVID because it was very hard to find individuals that maybe wanted to work full-time. Maybe they just wanted a small a project to work with us. So yes, food service, one of our highest priorities because we know how that can really impact the community. We just actually COVID, hired new sanitarians that came in, helped us with COVID. Now we're training them to get them back. There's a lot of training that goes into someone before they can do a food inspection by themselves. And so bringing them up to speed takes months. So we're getting, I think it's 6 or 7 new sanitarians, which are our food inspectors, up to speed, and they'll be out providing that service. But I have to say, our environmental health staff, they pick up the slack as needed. When they know someone, those food establishments don't go uninspected. Every 6 months, someone is in there. They're making sure that happens. So that's one of our highest priorities when it comes to food service. And the last thing I want to say about social media, because I know we don't have a lot of time, is we have a very robust social media team. I say one of the best communication teams when it comes to public health that exists. They're on top of it. They're providing this weekend with the water main break to the Wixom spill, and then the plethora of services that we offer, making sure they get that information up there. They're pretty much, they go, I think, 24/7 on our social media pages. So,
Excellent.
yeah.
Commissioner McGilvery, followed by Commissioner Cavell, and we got about 2 minutes for all of this, so.
Two quick questions. In your KPIs, you mentioned better access to parks and recreation. How are you going to do that? I'm curious.
So one of the countywide goals is, and I have to get to it so I don't misspeak, here it is. One of the county goals, the strategic goals, is ensuring access to parks and rec, transportation, and healthy food. So it actually falls in that children who are food insecure into that healthy food goal. We are not directly responsible for Parks and Rec, but we work a lot with Parks and Rec, especially our health education team, our HOP program. So they're a great partner of ours. We're just not directly responsible for that piece of it. It's really that healthy food piece.
Okay, thank you. My other question is for Shane, and God knows we have a need for affordable housing in Oakland County. What are we doing to try to improve those numbers?
Well, I think a big, wonderful first step is the approval of the Housing Trust Fund and the framework and getting that stood up. And that's something that we can directly, add to some affordable housing stock within the county. Now, are there enough resources that we have direct control over for, building and creating affordable housing stock here at the county? No, we don't. So what else can we do? Well, it's then looking at conversations with other policymakers or developers. What are their barriers to making more affordable housing that they might want to make, and kind of helping to convene those conversations and bring people together and kind of putting, a voice locally around where are those levers that we can help to encourage affordable housing development outside of our direct funding for certain affordable housing projects. When it comes to affordable housing, there is no silver bullet. It's a combination of things. For example, if wages were able to be increased, workforce development, they would increase their household income and salary, thus making them less housing burden. And so there's different places to help kind of put a thumb on a scale a little bit to approve those. And for example, partnering with workforce development, coordinating with what they're doing to help improve the workforce and the salaries bringing in. It's those kinds of partnerships, those kinds of conversations outside of what our direct individual programs are. Those are some of the things we're working on.
Okay, thanks.
Okay, next up is Commissioner Cavell, followed by Commissioner Kowal, followed by Commissioner Powell. Okay?
Oh, okay.
Try to make it quick.
Yep. So, well, I guess Commissioner Charles kind of was asking this about sanitary stuff and food, but are there any things in your budgets, respectively, that you would have wanted but you didn't get and it's going to impact the way you do your job?
I don't know. At this point, not for health, but you may have.
Don't think about Kyle being here.
To the
Yeah.
affirmative, will we get more money?
Well, then Kyle's over here too, remember that, so.
Don't worry about that guy.
I'm just
But,
joking.
yeah.
No, I mean, I can say across the board, I think we have done very well to prioritize and work with the executive team to get all the items that we need. I think we're lucky that we have some great grant funding, and I'm talking about health because maybe Shane has some items that he would like to talk about, but really looking at what the priorities are for the county, right? And the mandates that we have, I feel like we're in really good shape, so.
I mean, again, most of our budget, 90% of our budget is special revenue, and that is largely dictated by, certain things that we have to do for HUD to be able to expend that money appropriately, et cetera. And so those services and those projects and those activities and funding streams, we had the individuals, we had the positions to be able to facilitate those projects. The Housing Trust Fund, we asked for a couple part-time positions. We got that. We're going to find some good people and staff that up. And then I think really our next step within our division is as we start to implement some of these new things that the division has never done, how is that working out? Do we need to come back and ask for more? And I think that's where we are with our stage is assessing just as we stand up and implement these programs, just is the workload exactly what we were envisioning that it was? And we ultimately won't really know if that is or not until we actually start to kind of have the rubber meet the road, so to speak.
Okay. And last question real quick, which is, so some communities come out and talk about gun violence being like a public health crisis. I mean, where do you all stand on that? How is that a part of your consciousness and work related to public health?
Okay, so we have some partnerships that focus around this. So I think maybe you've talked to Hannah Cassisi, right? Or a couple of you had. She really works on our harm reduction areas, and so it is something that we're focused on. We work with partners in the community, right, to safely lock up guns. And so if that's something you'd be interested in, reaching out to, I could connect you to, and she could kind of go through what the partnership is doing at this time.
Cool.
Okay.
Thanks.
Thank you. Commissioner Kowal.
Thank you, Madam Chair.
Kowal and then Powell.
Oh, okay.
Okay,
Yeah, thank you.
I didn't forget. Can't forget, Angie. I'm just trying to. Anyhow, I was just wondering, it seems like in the past we've had somebody come from environmental health. Nobody today, apparently, and they're just, I mean, that's a significant part of what you do. And I see it's kind of mentioned in a few of the 101 KPIs relative to that. So I guess, maybe we'd like to hear from environmental health a little bit more.
Okay.
Because they're just kind of not represented here today.
Okay. So really, we have about 5 areas in the health division, right? Not just environmental health, but some of the nurses. So
Yeah.
that's the area I came from. That's probably the area I know the most about because I was in environmental health where we started. So knowing that we can answer probably most of the questions you have, and then if not, always bringing Tony back or connecting you with Tony or Mark if needed. But thank you for that.
All right, thank you.
You're welcome.
Commissioner Powell.
So I've had the pleasure of seeing all of the prenatal care billboards and stuff. So I just want to know, how is that program going? And did you all do the extra billboard marketing to kind of increase this program, or what was the science behind that?
Sure. So this is a state-funded program, Nurse Family Partnership. We've been doing it since 2004. We started out with 4 nurses, and now we're up to 7 nurses that run that program. It's for first-time moms, less than 29 weeks gestation pregnancy. We follow them through the 2 years of life. The reason why you see the billboards is because during COVID, over the last 2 years, we saw our referral base going down for our program, and we really wanted to put some energy behind it, because we know that we still have a significant need in Pontiac to reduce infant mortality and preventable deaths. And so we really put some strategies strategies behind it. You will see those not only in billboards, but you'll see those flyers in grocery stores and barber shops. We've put a little bit of a different spin on nurse-family partnership, and I think that has to do with me being an influencer in the city of Pontiac, in which I live, and understand some of the needs and challenges that folks have. And so really working with my team to kind of stretch a little bit more than they've stretched before to try to get those referrals. We didn't have an easy way for folks to get a hold of us. We didn't have outreach like we're having now and being present in the community and talking about these programs. I was saying before you came here, I left flyers at Prospect Missionary Baptist Church last night as part of the District 7 meeting. I just hopped in just to talk to folks about it. We have been reaching out to moms. We have not looked at dads. I understand there's some dad programs out there as well, and we need to be reaching out to dads that take advantage of this program for their loved ones as well. And also, we're putting a pitch in for grandmothers and great-grandmothers who we know are supporting and helping to raise their grandkids and great-grandkids to take advantage of this free programming. One of the areas that is really hard to infuse is our Medicaid providers, and so we're working with St. Joe's to really talk to Dr. Rahman, who is the chief over there, to really come in and look at bringing programming right at the hospital level. So these are some of the things that we're doing. We're just trying to really increase our referral base. We'd love to be able to turn people away because we have our caseloads at max, but our caseloads are not at max, and we need to do more. We need to have a bigger footprint in the community in order to raise those referrals in order to really reduce infant mortality.
Well, I'm going to say, I know you said that program started probably 2 or 3 years after I had my daughter, but I was in a similar program, and they may have just changed, what they did, but if you ever need a commissioner or just a mom to advocate or tell my story, I will strongly encourage that, because as a mother, even though I had a great mom, my mother's deaf, and there is some challenges in the communication, just her trying to teach me to be a mom, right? But that nurse, let me tell y'all something. This program is out of sight. And remember, I know I say this all the time when y'all come before us. If I ever got to advocate for funding for us to keep program, we're going to keep this nursing program, because it helped me out tremendously as a young mother. And I'm so happy, Calandra, you're on it, because yes, our city do need it. We're both products of Pontiac. And so I'm always interested in this program, okay? So I do want to give that offering. So if y'all ever want me to speak to mamas or anything, I'm all for it, because I think that is a phenomenal program. It helped me out tremendously. There's a lot of stuff you don't know as a new mom, and it was a wonderful program. So thank you for that. And then my only other question is, I see the bid, because I'm on the board for OSHA, and I see that we're opening that. Are we just looking to go with another program for the WIC program services, or what's come behind that? And sorry for my tardiness today.
Okay. So what that is every 5 years we have to look for someone to deliver the WIC services.
Got it. Okay.
So in the field,
Okay,
remotely.
got
So we just put it out. ULSA got it 5 years ago. Probably we'll get it again, but we don't know who the new partners are in the community. So we go out for RFP, and they go through the criteria, and we'll select who is the best
Following
person.
contract,
Yeah,
county purchasing
correct.
rules.
Yeah.
Okay, all right, thank you. That's all I was wondering. I'm on their board as a commissioner, so, okay, thank you. Thank you, Chair.
You're welcome. Anybody else have any other questions for this panel? My only question, and I won't belabor this, but I live out on the far west side, and a lot of this conversation is about Pontiac and Southfield, and I know that's where the greatest need is, but we have poverty all over the county. So tucked away, and where I live, it's tucked away, it's not so obvious. It might be in the mobile home parks, or it might be, in the really rural areas. So my question would be, how do you find clients out in those areas? And I don't even necessarily need an answer today, because we're trying to move this along, but it's something I would like you to think about and consider, because I do think wherever you are in the county, there's poverty, there are new moms that need help, and how do you reach those clients that aren't in the targeted urban areas? So
I thank you for that. And I'll just say that I know we talk a lot about, Pontiac, but we're saying that for a reason, right? Because we put that equity lens on everything that we do pretty much.
Sure.
I want to say that the Nurse Family Partnership is in 3 zip codes across Oakland County. We focus primarily on Pontiac because they have the lowest rates in infant mortality when we look across the county, but we certainly provide these services to everyone. So I just wanted to add that in.
And I just want to throw one more thing is we are aware, right? We really saw it during COVID too, right? And so conversations, actually just this week, Calandra and I had with the county deputy executive about some ideas that we wanted to do. We do have a WIC program, though, just so you know, in the West, so they connect us with a lot of services, which helps. Still minor, but something we are aware of and starting to look at how we can and make some changes out there.
Good, excellent. Well, if no, Commissioner Powell.
Just real quick, so if we did have potential areas outside of, like, for example, she know of a location, I was about to say something wrong, a location that, like she said, is tucked away, is there any way, like, she can probably set that up to get some
Yeah,
communications
that's what I'm
out
thinking
there and
about too.
stuff?
Maybe we can do some
So
pocketed
long as we kind of
stuff.
let you know, oh, we got this area, and then y'all can vet it out and see. if y'all can-
Absolutely.
okay,
100%,
We'd love to do
yes.
that.
Yeah, let's do that. Because sometimes they don't know, and sometimes we gotta let them know. Y'all don't know until we tell y'all,
Right.
right? Yeah, so
Right. Thank you for that. Anybody else have anything they want to add? Going once, going twice? Well, thank you very much for coming in and talking to us. You're a huge division and a, really important part of the county government. You're certainly one of the most public reaching and contacting departments that we have, and we're really grateful for you and all the work that you do. So thanks for coming in today and sharing your budget and your plans with us.
Thank you for having us.
We'll take a 5-minute break to let the staff set up for the next review, and I'm going to do my, and Charlie's going to go be Charlie.
Thanks, Gwen. There you go. That's right.
Somebody would have submitted a mileage check on your behalf then, and it's set up to go by check instead of
Yeah.
ACH.
Oh.
Because you can change it to have it direct deposited, but my guess is
Somebody submitted it.
someone from the board, I would guess. You can ask staff then, because that would have been through fiscal.
Those checks, yeah.
Yes.
Yeah.
We've started getting those checks instead of having it just be added into our,
Oh, so you have to go on your workday.
Expenses are different, but expenses.
I did, I went
You have to go on your
Workday and
workday.
changed it.
Oh, okay.
Yeah, Commissioner Long, you have to go on your workday and change the
Because I ran
information
into
to get
Kenya
direct
over in the
deposit.
EOB the other day, and she's
Because
like,
it's two
"I
separate
submitted
things.
some
It's
stuff."
two separate things. One is your pay is
Yes.
direct deposit, but this one I think automatically defaulted to check, and you have to go change it. Correct.
You have to go to work.
That happened to me too.
Gas was more, that this
Yeah.
was like a makeup check, you know, but I
Yeah.
want you to get
No,
a check
thank
off.
you.
It's funny because that happened to me, and then obviously it's our department. And Julie, who
My
cuts the check,
meeting
she's
is
like, "Do you want me just to
getting
hand this
away
to you
from me."
instead of mail it to you?" I said, "Yes, please."
All right, I'm gonna try and herd these cats back together
All
here.
right.
We're all back. We're not gonna call roll again. We just took a recess for a second. Okay, next up on our agenda is the treasurer's office for today. Welcome. Please introduce yourself, although we all,
That's
for the
okay.
record. And then tell us what you want to tell us, and we will ask questions after you're done.
Perfect.
Thank you.
Thank you for having us. I'm Robert Wittenberg, Treasurer. I'm joined by Jody Weisler-Defoe, our Chief Deputy Treasurer. And we will be brief. We will try to be as brief as possible and leave plenty of time for questions and plenty of buffer time for the next group coming after us. So we're presenting the Treasurer's Office budget for fiscal years 23 through 25. And this general fund continuation budget of $8.6 million provides the necessary resources for our office to continue delivering statutorily required services. We believe our residents deserve access to the highest quality of service from our team. And some of the duties within our office include collection of delinquent real and personal property taxes on behalf of our 63 cities, villages, and townships here in Oakland County, receiving and dispersing county funds to meet the county's cash flow requirements, investing of surplus funds in accordance with the county's investment policy, which we updated this year, and thanks to all of you, and Public Act 20 of 1943, administering the local government investment pool, the LGIP, which we are unique with that, one of only 2 counties in the state that has that, serving as the treasurer for the county's building, arts, zoo, public transportation authorities, and the retirement system as well. Managing the debt portfolio and supporting the retention of our AAA bond rating for the county, and as well as launching the new Oakland County Land Bank Authority, which there's some other news separate from that. We continue to monitor tax collection rates, and the good news is there was a decrease of 8.5% in delinquent taxes turned over to our office this year, so that was actually really good news. Last year, it was $66.8 million for 2020 taxes, and this year it actually went down to $61.2 million for 2021 taxes that were turned over to our office. But with the economic uncertainty, delinquent taxes being turned over to our office may increase in the future, as we are often a lagging economic indicator, so we are closely monitoring that. Our office remains steadfast in our commitment to fulfill our statutory responsibilities and to assist Oakland County families and businesses to avoid foreclosure. Our team conducted 1,682 one-on-one confidential calls with taxpayers to prevent foreclosure, along with we had a very robust media campaign, community outreach plan, 4 mailings that we did per year, and then we also visited and posted every property that was subject to foreclosure, so we made personal visits to the properties. We will continue to offer flexible payment plans to assist property owners experiencing hardships, as well as the services of our Financial Empowerment Center within our office, also like a financial coach within that area. And as we know, property foreclosure disrupts the financial well-being of our residents, our business owners, our neighborhoods. I always talk about it doesn't just impact the person that is being foreclosed, it's the whole surrounding area. So that's why it is of our utmost importance to try to prevent foreclosure and why we work so hard to do so. We've completed settlement and distribution, and this is to help cash flow local communities. And we continue to administer the delinquent tax collection process, which does fund our DTRF, that delinquent tax revolving fund. And then a few additional highlights that we will add is in April 2022, so just this year, our office went live with DevNet. It's a new delinquent tax collection system, and it was a long time in the making. It took, I think, 6 years, so this is predating my time here, and significant development time with our staff and our developer to rewrite. We had an in-house software that was from the 90s that needed to be updated. So we are in the midst of getting that finalized, if you will. We went live, but obviously working through some, I would say, none are major, just minor, things that we have to deal with here and there. But the team we've been working with from DevNet has been really supportive and really helpful. As we were, Commissioner Long, as we were talking about just before we got started, in May of 2022, our team, in collaboration with the rest of the county, we went live with Workday. It has been a significant change for our team to learn and support other departments who interact with our office or depositing funds or paying vendors. You specifically. Just last week, we held the first Oakland County land sale of tax foreclosed properties since 2019. So this was the first sale that we've had since 2019. And that was obviously due to the pandemic, that there was the pause for 2 years. It was also the first time that we've done the auction online. We thought it was for increased transparency, accessibility, safety, many reasons why we thought it was worthwhile to do it online this year. We took 374 properties to sale. 309 of those properties were vacant land or vacant lots. So that's good. That number was low, and then predominantly was vacant property. Our preliminary sales from our auction vendor show 194 properties sold, recovering $2.4 million in unpaid delinquent taxes. And then furthermore, the claims process, I know I came and presented to both caucuses about this claims process. This was from the new state statute that was passed in 2020. It started with this year's foreclosures, with the auction this year. So the people that submitted, we had 27 claims forms that were submitted from owners or interested, or people that held an interest in the property. And then we will notify them of their surplus, if there is a surplus, in January. Then the circuit court will order the claim paid by 2023. So that's that new process. And like I said, we came and talked to all of you earlier in the year and really encouraged people to apply before that July 1st deadline. So I think that's all we have to cover. I don't know if there's anything else. I think we covered everything. So like I said, we were trying to be efficient just to give you a high level of what's going on, and then we're happy to dive into any of the details or any of the specifics that you would like. So, but we appreciate your time and consideration.
Okay, I'm going to start with Commissioner Charles, who has requested the right way.
Hello there.
Let me test it and see if I can get in the queue. I'm going to ask a kind of canned question for you, Robert, and it's good to see you and your team. Are there any encouraging or discouraging forecasts the Treasurer's Office can provide this committee regarding lagging economic indicators such as tax foreclosures? Even if you have any leading indicators, I'll welcome those as well.
So, what we kind of mentioned here, I think that was very good and promising for us to see that those numbers when we talked about the delinquent taxes that were turned over. So that's, again, just to kind of reiterate for everyone here and then anyone that might be watching at home, right? You pay your taxes to your local community that first year, and then when they are delinquent, they get turned over to the county to, in essence, become the collections agent, and we cash flow the local communities. So we are monitoring what that number looks like, how much is turned over to us. And the fact that it went down 8.5% from the previous year is a really good sign. It was actually quite a bit higher, lower. It depends on how you look at it. The number was a lot lower. The percentage was higher. That was turned over, and that's a good thing. But that was actually, from years prior, it was holding pretty steady.
Yeah, it had been 66 million for the last 3 years prior to this year, and then it dropped $5 million. So we kind of thought 66 million was like our kind of standard where we were going to sit for a long time, as long as the economy didn't, make a drastic turn on us. But, we saw this,
Yeah.
nice downturn.
So that was something that was a good thing to see, and we'll have to monitor next year and see what it looks like. Because again, and I mentioned this probably when we've met in past, that there were the safeguards put in place at the federal level that we know impacted the previous year's taxes, but could have impacted the ones that we're talking about today as well. So I think next year will be a really good indicator, I think. So I think that'll be a good indicator, as well as when we talked about the properties that were foreclosed, that went to the auction. And again, that auction, that is per state law that we have to hold that auction. The years just before we had put that moratorium for the auction, we were seeing around 200 or so properties that were going to foreclosure. And so if you consider that we had 2 years off and, it was just a pause, right? And then anyone that came out, if they didn't pay their taxes, they could have been foreclosed as well. We were assuming that we would see 600 or more properties in the, that were foreclosed upon and that were at the land sale. That number was lower than we had expected and anticipated. So that was another good sign. So those are the good.
I mean, the one thing that I would also say is that I think we've talked also about the MyHalf program, the Michigan Homeowners Assistance Fund out of MISHDA, which will pay up to $25,000 if people are behind on their taxes due to a COVID impact. We've seen hundreds of people apply for that program. We're seeing funds, come in. I know the water department is also seeing funds come in. There's still a need, right? I would say so from some perspective, there's still a need from homeowners to get help.
And along those lines, encourage everyone that the MyHalf program is still open. There's still funding there, and encourage people to apply if they qualify. And if they don't know, they should look online or reach out to our office, and we can help. But again, it's $25,000 per household that they can use for delinquent taxes, mortgage, utilities, association. Yep. So there's quite a bit that's covered there. So hopefully that answers your question. Again, we are monitoring, but we haven't seen anything that is for us to worry at this point. But obviously, we are looking at the numbers as they come in. Thank you, Commissioner Charles.
Anything else, Commissioner? Okay. Commissioner McGilvery and then Commissioner Powell.
Is there any funding that you requested that's not included in the county executive budget, recommended budget?
No.
No.
Is that it, Commissioner?
We like to be fiscally responsible. We like to be, we're frugal. We use what we need to use and nothing more.
I'm glad to hear that from our treasurer.
Yeah, right.
Commissioner Powell.
Hence, I might be wearing the same outfit I wore last time I was here because I'm frugal in my household as well, and my wife might judge me.
TMI.
Yeah, really.
Yeah, okay. I need to buy some new clothes every now and then. I wear shoes until they are no longer able to walk in them.
Hey, my car is held together with duct tape right now,
Yep.
so I understand.
All right, thank you. Thank you.
Commissioner Powell.
So I have two questions. One is, what information, you already know why I'm asking this, because half them houses on that auction list was in my city, and I've already.
Properties, though, properties.
Property,
It was mostly
Lots.
vacant lots.
Yeah.
So, but yes.
But I've been texting Miss Jody over the weekend because I've been getting questions. So my question is, what information will we be privy to and as commissioners? And then are you all capturing and know who is like purchasing these properties? The reason why I'm asking this is because I was told I had bidding wars on there and it was the same 3 emails. Because you can't see the whole thing, but they kept track. And they said it was the same 3 emails that really bought up our city. And, I'm just interested to know if that type of information we'll be able to know. as commissioners?
Well, so everything ultimately will become public
Oh, okay.
because it is a legal process, right? It is a transfer of property
and
and ownership. So that, and then that has to be filed with the clerk, so that will be
Oh,
public
so-
information. We, like I said, we gave you preliminary numbers because it is not finalized. The auction closed on Friday, and there are 5 business days, in essence, to make sure that the winning bidder wants to follow through with their bid and is able to make payment. So it will not
But
be.
also for us to check and ensure that the people that bid are abiding by the rules, which are they cannot have any delinquent taxes in order to be a winning bidder, and they cannot have lost the property. The person that loses the property cannot bid on their property at the auction.
Got
So
it.
that's what our team is reviewing
Okay.
right now.
So, but that will be public when it's finalized.
Okay, and then can you give us, what's the next step? So, because I've been asked that. So now that all the properties having, with the remaining, after y'all get through, what's next steps?
So there were those that sold or will be
Well, not
finalized.
so, the ones that we
That
didn't
did
sell,
not.
yeah.
There will be a second auction.
Okay.
That's per the statute as well. There is a second auction that will be in the fall.
Okay.
However, the company we're doing with might do like a resell.
Yeah, so they actually, for anybody that walks away from this auction and the second or third bidder are not interested, they're gonna basically do a redo sale of just the few properties that people walked away from statewide. So all properties that somebody walked away from statewide is going to be on September 28th.
Okay.
And then the properties that did not sell will come back up for auction at a reduced bid amount, a minimum bid amount, that will be at the end of October. It's like October 28th, I think, something
Okay.
like that.
Thank you, I just
Yeah.
wanted that.
And
to-
anybody that's a registered bidder will be communicated that information from the auction house.
Okay, great. So that's that. Now, with my second question now is the Raffaelli stuff.
Yeah, that's where I was
Where are we at with that? And when does that process, well, just where are we at with that? Where is it at in court?
It is.
Is it still in court?
It
Okay,
is.
it's still in court,
It
okay.
is. I can say that there was, because it's public, that there was a settlement that is being negotiated.
Right.
But it is not finalized,
It was
proposed.
proposed in
Proposed, I
federal
should
court.
say. Not negotiated, but proposed. So we
That's where
are.
it's at, okay.
Correct. That
Yeah.
is where we are at right now.
Okay,
And you all, commissioners, obviously set aside a pot of money. And so that's part of
The
discussion.
negotiation, okay.
Yeah.
I just wanted that to be on record so people know, because we do, have people watching and they're ready to lock and load and file
Yeah.
if it happens for them to get their money back. So
Right.
I just wanted that for record, and I know we know what's next steps because we've been debriefed on that process a little bit. But I know when that time come up, we'll be debriefed again to update and get that process moving forward. So thank you very much. Thank you, Chair.
Thank you.
Thank you, Commissioner Powell. Commissioner Moss, you had a question.
Actually, Commissioner Powell asked my question in precisely the same language I was going to. So,
All right, we on the same page today.
Great minds. Think alike. Yeah.
maybe hers is great.
Yeah.
No, you are too, buddy. You wouldn't be in this seat either.
Don't be so sure.
Anybody else have any
seats here.
questions for the Treasurer's Department today?
I can lock and load and ready for us. Good job.
All
wanted to
right,
catch
they
you
got
up
us
on-
back on track,
Get you on
too. They
track.
get a gold star.
You're very welcome.
We are happy
Thank you
to.
for
You can
coming.
add a 0 wherever you'd like.
And obviously, if you have any additional questions,
We
after
know
the
where
fact,
to
please.
fiend you.
Yeah, we're about as close as you get to where you meet. So
You are, thank
You know where we live.
yes, exactly.
Literally, I mean, you've got the.
We have your address. Yeah.
All
We
right.
do.
Well, thanks
All
so
right,
much.
Thank you all so much.
And we will take another 5-minute, well, the next group's due in here at 2:40. Oh,
Yeah,
cool.
actually, might grab an apple. If you don't mind.
Thank you.
From my understanding.
Okay, we're going to take a 10-minute break.
Yes, and they said a
10-minute
lot
break.
of the houses
camera going. Okay. We do have a quorum, 1, 2, 3, 4, 5, and Angie's in the hall, so you're lilting around, yep. Okay, so our next group is Public Services. Welcome.
Thank you.
And we're going to ask you to go through your presentation, tell us what you want to tell us, and then I'm sure the commission's going to have a whole bunch of questions for you, so welcome. And remember to introduce yourselves as you go.
Yes, thank you. So good afternoon, Commissioners. Thank you for the opportunity to present. My name is Barb Hankey. I'm the Director of Public Services, and with me today I have the managers from each of the 4 divisions. If you want to just introduce yourselves.
Good afternoon, I'm Bob Gatt, the manager of the Animal Control Division.
And my mayor.
Kaz Mayarka, administrator for the Medical Examiner's Office.
Heather Calcaterra, the manager of Children's Village.
Eric Schmidt, the manager with Community Corrections.
Okay.
So if you're like most people, you're probably sitting there wondering what in heaven's name could these 4 divisions have in common, and why are they all under public services? And they do obviously perform various different functions and service different populations. But the one thing that they do all have in common, unfortunately, is that we're often dealing with people at some of the very lowest, points in their lives. Whether it's perhaps a lost pet, or experiencing the death of a family member, or navigating the incarceration of a loved one. So it's very important that we do our jobs efficiently and effectively, so that we don't cause any additional heartache or stress during these already very difficult times. But it's beyond just doing our jobs well, it's also important that during these difficult times that we treat everyone that we deal with the dignity, fairness, and respect that they all deserve. So again, thank you for letting us come and talk a little bit about what it is that each of the divisions do and how our programs and services support our budget priorities. So as you're aware, all of the county departments have gone through key performance indicators. These are our headline key performance indicators. We have 4 of them, 1 for each of the divisions. And I just want to go through them quickly. And you may also notice that after each of them, I sort of have a budget priority 1 and 2, or budget priority 3. When we originally got a questionnaire that was put out that the board asked each of the divisions to fill out about their budget priorities, it's difficult because with the 4 very different divisions, they have different priorities. But we sat down and we looked at what is it that we have in common. And so we came up with 3 of our top budget priorities. And the first one is that we support programs and services that provide alternatives to detention for adults and juveniles. The second is to provide programming and services that recognize and remove barriers and challenges to participation in programs. And the last one is to maintain programs and services that provide the residents of Oakland County with the exemplary service that they've come to expect. And so these are some of those measures that we're using to make sure that we stay on task with those budget priorities. And the first one is the defendants on pretrial supervision who remain arrest-free. Under our community corrections, our pretrial unit allows people to be in the community during the pendency of their trial. So they can be ordered onto our supervision so they can remain free. And of course, while they're out, we want to make sure that we're maintaining that public safety. The second is the percent of youth admitted to secure detention by race. Obviously, we're looking at who's coming in to Children's Village and why they're there. The live release rate is with animal control. And this is the percentage of animals that leave the shelter by means other than euthanasia or in shelter death. And basically, the industry standard is 90% or higher to be considered a no-kill shelter. And the last is with the medical examiner's office, and that's the percentage of identified decedents that are released within 72 hours after autopsy. And I want to just go into each of these just a little bit more. Again, this is this particular headline KPI in the industry we also call the public safety rate. Everyone in the criminal justice system has a presumption of innocence, but we also have to balance that with public safety. And so I think this is showing that we're doing that very well. As you can see, upwards of 80, well into sometimes 90%. We have individuals that are released to our supervision that remain arrest-free. However, there are some people that are rearrested, and so we're using this data that we're collecting to see why are they being rearrested, and for these individuals who have been rearrested, what are we missing? What are the services or programs that maybe we're not giving them that they need in order to help them be successful? For Children's Village, this is the percent of youth admitted to secure detention by race. One of the things that we learned in going through this KPI process is that you can't look at just any one measure and expect that to tell you the full story. So when we look at this measure, we say, oh, well, we might be doing pretty good. And in fact, oftentimes we have many more white youth coming into Children's Village than black youth. But we have to put those numbers into context in order for them to make sense. And that's what we've done here. The Census Bureau tells us that the African American youth population in Oakland County is about 17%. That red line that you see there is 17%. So as you can see, this information is telling us that African American youth is overrepresented in Children's Village according or compared to the general population. For the animal shelter, thank you, commissioners. There about a couple years ago, about was it a year or year and a half or so ago, the board commissioned a study that was done by Dr. Pisano. She came up with several recommendations, almost all of which have been implemented by the animal shelter. And as you can see here, our live release rate has continued to go up as we have implemented those. And we are considered a no-kill shelter, and we continue to be. And hopefully that will continue to be above that red line. The medical examiner's office. This is an example of using this data real time. All of the autopsies, to the credit of the medical examiner's office, are done within 24 hours. That's 7 days a week, 365 days a year, holidays, weekends, everything. But then the body has to be released to the family or the funeral home. And when Kaz looked at this originally, he said, what's going on? Why aren't these being, turned out quicker? And what he found was that many of the families were waiting for a phone call from the ME's office to say, the body is ready to be released. And they didn't know. And so now Kaz has already changed policy that as soon as the body is ready, the family gets a call so those arrangements can be made quickly.
Wow.
Simple
Right.
enough.
Something so simple.
Yeah, and it didn't cost anything. That's the great part, right? So across the 4 divisions, we've identified a total of 93 different KPIs that the managers are tracking. Some of our key budget changes, we did meet our 4% task as a department across all the divisions. There were some small workforce reductions, but nothing that has, affected us significantly. A few new investments that we're looking at, we just applied and it'll be coming in front of the board here, I think, in the next meeting or so. The JAG Burn Grant we asked for $20,000 so we could work with an outside agency to develop some focus groups to determine why particular groups aren't reporting hate crimes. When we were looking at hate crimes, we saw that we have a very low incident of hate crimes, which on the face seems great, or is it just because they're not being reported? And so that's what we're looking to do there. And then under our funding shifts, when we closed our weekend alternative for misdemeanors program, it was a work crew program because of COVID. We shifted the 2 full-time staff into our pretrial supervision unit because we went from 800 people on supervision to over 1,700 people on supervision so that we could continue to manage that workload. Some of the major initiatives that we have coming up that are new and ongoing, just about almost 24 months ago, we undertook a community or criminal justice mapping initiative, and we mapped the entire criminal justice system, both the adult and juvenile, and that was done by an agency called Justice Management Institute. And just in a few months ago, they released their final report for us. It contains over 22 recommendations on things that we can do to basically improve our system and where there's bottlenecks. So we're going through that and looking at what recommendations we can turn into projects and maybe bring forward in either grants or even possibly next year. We have a new program under Community Corrections for justice mentors. So peer recovery coaches are very big in substance use community. And so we're going to be using people with lived experience from criminal justice, returning citizens, to sort of mentor other people that are in the system to help them navigate it and work through the challenges and barriers they might be having. The ME's office is taking on Lapeer County contract for autopsies. And in animal control, we're looking to do some in-house, offer in-house training so that potential animal control officers can get their certification from MDARD. And also the expansion of our outdoor kennel space is underway. It's in the bid process right now. For IT, the anticipated projects we have, the data that I just shared with you doesn't come easily. And so we have some projects in the works with IT in order to be able to pull that a little bit easier. And then we have a few contracts up for bid. Again, the animal shelter, we've got our outdoor kennel that we're bidding. Community corrections, we have an access liaison. We've changed the scope of that based on changes in the population that we're seeing, and we're going to be providing a trauma curriculum because we see that as being essential to the individuals that we serve. And then Children's Village has a couple of major contracts that will be bid in the coming year. So with that, we'll be willing to take any questions.
Okay, we'll start with Commissioner Powell.
Hello.
Hi.
Okay, so my first question is, what was some of the rearrest reasons? Like, what was causing some of the rearrests when you alluded to the rearrest population, but what was some of the findings that you came up with of why?
That's what we're looking at now, right?
Oh,
because
okay.
this is just from 2022 and late
okay.
21.
All right, I'll give you time for that one.
Yeah,
Okay,
thank you.
and then, what are some, well, this may be another study you're looking at too, what are some of the measures being studied to reduce that African-American detainee rate as far as in the juvenile? So
those are projects that we're developing, but one of the things that we think will help, and is one of the recommendations that came out of the mapping, is to have an assessment developed that will help drive the detention decision, because right now there's not really a formalized process for that. And while, everyone in the system is acting in good faith, but, this person doesn't know what this person is doing, and then it sort of exacerbates, and then we have this disproportionality. And so, again, one of the things that we think that we can do to help combat that is have an objective, validated assessment to help drive the detention decision, to remove some of that illicit bias or implicit bias.
Okay, got it. And then my last question is there any services that help parents whose kids have been in our juvenile system, they're charged a fee for their kids to be in this system, once, and now this parent is stuck with this bill, is there anything that assists them, or they just stuck with the bill and has to pay it? Because I know it go on their credit reports as well.
And that is something that we are looking at with the administration. And there's also the statewide juvenile justice task force just put out their recommendations, and they're also calling for an elimination of those types of fees.
Ooh, I need to keep me up to date on that, because I know it's a lot of low-income mothers or parents, fathers too, who get these high, extensive bills when their kids get locked up, and it's on their credit report, and it is a issue when they try to, do other things with their life till they get that bill taken off. So
absolutely.
Thank you very much.
Thank you.
I'm done.
Thank you, Commissioner Powell. Next up is Commissioner Charles, and then Commissioner Moss. Commissioner
Yeah,
Charles
thank you.
is on the screen.
Yeah, I appreciate that. And I am, listening and looking, and I'm on the website. It's kind of hard to quantify exactly public services. You mentioned I guess there's 5 people with you today, from Animal to Children's Village. There's some other things, but just as an observation, it is a little murky. When I look at the org chart, just trying to understand that, you're talking medical examiner, which I guess is no longer associated with the health department. But out of all of those question marks that I have, and I'll digest before we have our fill-in meeting next week, where we might be able to dig in and have questions answered by staff, I am incredibly troubled with there's so many ways I could put it, but basically the over-criminalization of Black bodies. The fact that we would have those kinds of numbers with that red line supposed to be at 17%, and we're like blowing through 70%. That is acute. That is right now, all hands on deck, something has to happen. And it doesn't take a lot of training to understand what's happening. Just turn on the television and look around. And so I'm incredibly concerned because the population of Black people in Oakland County isn't high enough to sustain those kinds of numbers of our young people being in Children's Village. So I'm going to actually be digging in way more deeper into this over the next week to get some more insight, because the money needs to go where our priorities are. And so this is, now that it's been raised to the level of my awareness, is definitely a problem. And like I said, an acute problem for our young students and young people in this county. So I'll land my plane there. I just needed to be reflected, the importance of that, and a study and going back to the table and drawing boards for months and months and months. Students don't have that kind of time. Every day that they lose with time with their families or time with education is going to end up the prison to prison pipeline. And I know Oakland County doesn't want to be a part of that. So thank you for listening.
Thank you, Commissioner Charles.
Can I just comment?
Sure.
Yes, I appreciate those comments, and it concerns us as well, and that's why we're looking at all of this. And I know the administration is also concerned about this, and we are, one of the initiatives that we're looking at is to move away from over-detention and moving to more community-based services, because it does cause disparate impacts upon the Black youth. So we are looking at that. Thank you.
Thank you.
You have my full support. If there's anything, any advocacy, letters written, money from sources, we'll look under every rock. But it is our duty to support those disenfranchised folk.
Okay. Thank you. Commissioner Powell?
I just want to let Commissioner Charles know that Ms. Hankey is at every table, at least in the city of Pontiac right now, as far as all our discussions about all our problems with violence, crime, whatever the case may be. So I have a high regard for her, and I think that she's going to try her hardest to help that community, because she has shown that admiration and I can't think of another word, but she owned it, Commissioner Charles, and I know that you're going to be on it with Ms. Barb. So thank you for that support. Ms. Barb know that she has my support, and I just want to say thank you and your team, because you have been at the table and dealing with all of the Pontiac people. So thank you so much.
Thank you, Commissioner.
Okay, Commissioner Moss.
Thank you. I'd like to, Mr. Mayor, Mr. Gadd, about the animal shelter. We had I'm sorry Marcia Gershensen's gone, because she chaired the committee that had all the recommendations. And one that always stuck with me was that, excuse me, that I forget polls they took, as that just an ungodly number of people who surrendered and gave their dogs and animals up to the shelter would really rather have kept them if they had, if they knew how to do it. And they might have had financial problems, or they might not know what to do. And it was an incredible figure. I think it was like an 80% or even more. and that if a dent could be made in the number of people who were giving their dogs back or their dog cadaver, that would go a long way toward decreasing crowdedness in shelters, and with just a little bit of maybe help to the families. And I thought that was a pretty good initiative to start. Are you guys? I haven't heard or anything specific talking about that particular aspect or program. Are you guys doing that?
Thank you for the question, Commissioner. Since Dr. Pisano came in to study our shelter, one of her suggestions was that we implement a program whereby we give alternatives to people who call or bring their pet in and want to give it up. Since then, over a year now, year and a half, we have offered all sorts of different alternatives, and there's other helps in the community if it's a financial thing, or if it's a breed discrimination matter, or if it's just a temporary matter that people need some financial help. So we have indeed addressed that. Working with Barb suggested to me not too long ago about a food bank for people who may be down on their luck a little bit and don't want to give up their pets. We're just waiting to see how much money we have left in our legacy fund after this outdoor expansion is completed. And then we are going to address that need also. So it's certainly a major issue. You're right, and we want to prevent anybody from having to give up their pet that don't want to.
Just to be clear, that's an animal food bank, so.
Right.
Oh, yeah. We assume so. Yeah. I would hope that families that have human food problems go somewhere and can get that taken care of too, without a doubt. Yeah, because if your shelters are full and you're going to have to euthanize animals and things because there's no space, and yet if you can keep them coming in, and a large number of percentage, I was surprised. That would be great. Besides, as someone we've adopted a lot of dogs, and it helps them. It's not good for the animal. It's not good for the family. They're sorry, and so it would be a good kind of thing if you can prevent that.
Another suggestion that Dr. Pisano gave us that we've implemented was not to be so quick to accept pets. When people call us and they want to surrender their pets, obviously the staff is now trained to quiz them as to why. If it's something we can help with immediately, we do. If it's something that we really can't help, they just don't want the pet anymore, we'll make an appointment out a couple weeks in advance and give them time to think about it and maybe provide a different alternative for them rather than to give it up.
And as far as you deal with the rescues, I know all the time. Because, all the time. I hear from the Dachshund Rescue all the time. So, all right. Thank you.
Thank you, Commissioner. Commissioner Powell.
Question, be it if that outside expansion takes all the money, do you have a plan B as far as your dog food initiative?
We don't anticipate that outside expansion to take all of our money.
Oh, okay.
Okay?
But
Don't know
you
for
do,
sure yet.
But you do accept donations, right? If people want to make food donations for your new food drive initiative?
We get food donations every day, and we turn
good.
around and hand that food back out to the community when people need it.
Okay,
Absolutely.
great. Thank you.
Excellent. Thank you, Commissioner. Anybody else? Commissioner McGilvery.
Yeah, question for Barb. How has the department addressed the requested 4% decrease in your budget?
Actually, we met that request last year. So Heather had a small workforce deduction. Community Corrections eliminated a position that was in a retirement. Kaz had some contracted services money.
Yeah, and we also reduced some of our staff.
Reduced staff. So some of us were a little over and some of us were a little under, but collectively, as the department, we met that 4% budget task.
And that's not going to affect your department then, the 4% decrease?
Again, most of it was vacant positions that were vacant, and so we've been able to absorb that.
Thank you. Anyone else? I will say your presentation, more than many of the others, and maybe it's because you are such diverse in what you are in charge of, I think shows the real value of the KPIs and the fact that everybody is trying to break down what they do into these elements. These are what we do, and here's how we're going to measure them. And I think the value of that this year in particular is really starting to show itself. I would look at animal control, right? You had your study, you set some KPIs, and you are continuously improving your performance, where if we weren't looking at it, it probably wouldn't be improving that way. And I see that across all of these KPIs. Of course, Commissioner Charles pointed out the one that we're all really disturbed about, which is the number of black youth in our system, just in the system overall. But I think we also see that because of the KPIs, right? It's something we can start to talk about, drive those numbers down. So I'm an engineer by training. I love math. I love charts. I like measuring things. So it really struck me that your department is one that really illustrates the value of identifying what you want to measure, measuring it, and then taking action based upon what you find. So.
Well, thank you. We appreciate that. The managers worked really hard, and that is the value of the KPIs. And sometimes we all know something sort of intuitively, but actually being able to see it and quantify it really, takes it to the next level. So I appreciate that.
I don't have any other, Commissioner Cavella is back. He always has a question.
My bad. I'm sorry for being late. I had a day job meeting. So forgive me, but did you talk about the JMI?
We did.
Ah, damn.
Right
Okay.
here. I can send it.
Okay. So you told everyone about that? Okay. And then did you talk about 36th District Court? And the Ross case?
we
Does
did
that
not.
affect you at all? And if so, how?
We certainly anticipated what Commissioner Cavella is referring to is the settlement from the 36th District Court. The ACLU had sued the 36th District Court in regards to their bail practices and some other things. And the settlement that came out of that is interesting, and we're looking at it along with Corp Counsel and some of the other folks in the county, because we anticipate that may be the measuring stick that the ACL uses in the future to see what courts are doing. So while it's not binding on us, we do think that it could have implications.
Okay. Thank you. Anything else, Commissioner? Any other commissioners have any questions? You have anything you want to tell us or ask us about, or?
No, just thank you for your ongoing support, and we really appreciate it. Thank you.
Please feel free to raise up issues to the board if you have things
Absolutely.
that you need us to help you with. We don't want problems to fester out there, so thank you for all you do.
Okay, thank you.
It's kind of crazy.
And if you want a little snack, we've got snacks in the back, so.
Sound like it.
No, it is not negative.
Thank you.
All right. Our next group is the prosecutor, and they're not due here till 3:25, so if you've got a little something you want to. Are they here? Are they going to come early? Okay, we'll take a 5-minute break, and then we'll have the prosecutor in, and then maybe we can move this along a little bit today. That would be good. We're going to go with the Indigent Defense Council first. They're here and ready to
did it on
go,
here
so we're going to
already.
start
Pretty clever.
with them. Welcome.
Thank you, Commissioners. I'll let Commissioner Long find her page before it
What page is it? The big box?
Yeah.
I don't have it?
We switched everybody up.
I think it starts on 204.
Okay.
And then also we're on 451 is the,
Where y'all letting the short book? We ain't got one?
No, I know, I couldn't find it. The short book? 204.
Our short book, our small book, I'm sorry, let me do a small.
I know.
Okay, Chuck, I got it,
No, I'm with you on that.
The categorical.
It's on
I'm gonna call it
57.
the short book from now on.
57.
57, thank you, Eileen,
In the short.
Okay.
All right.
smaller book.
Thank you.
all right.
Let me
Please introduce yourself.
Thank you, Commissioners. My name's Pete Mena. I'm the Chief Attorney and the Manager of the Indigent Defense Services Office. And we're a division under the County Executive Administration. As you remember, we were created in the fall to implement MIDC Standard 5, which was moving all of the appointed attorney functions out from under the court. And so we manage all of the appointed attorneys on adult felony cases and also misdemeanor cases within our county-funded district courts, which are the 52nds. We have three major budget goals for this year. The first is to fund the creation of an in-house public defender's office. This would be the first of its kind in Oakland County, and it would be a major change in the way that our system is currently run. The second budget goal is to have significant compensation increases for our independent contractor attorneys. So those are the people right now who are doing the indigent defense work in our system. We don't pay them enough, and we need to pay them more. And so that's a significant part of our budget for next year as well. And then thirdly would be to increase the availability of expert witness and investigator funds to be used for indigent defense assistance. All three of these goals support our mission to provide competent, compassionate, and effective legal representation to everyone in our system who can't afford an attorney, and they also support the county executive's strategic goal surrounding criminal justice.
What is that strategic goal?
Well, improvement in general. I mean, I think that our piece of that, so that I think there are multifaceted goal. A lot of what you heard from Barb Hankey is wrapped up in that. Our piece is to increase the quality of indigent defense representation. So to increase the resources available to our appointed attorneys, to increase the quality of service that they can provide to their clients.
How would you measure that?
Well, I think there are several ways to measure it. One way would be to have oversight over the process to make sure that attorneys are actually doing work on cases. So for example, if you have a case that has a significant search and seizure issue, or it has an issue where your client's statement was potentially taken in violation of Miranda, are you doing the work necessary to investigate that? Are you filing the motions that you need to file to suppress that statement or to quash or suppress any evidence that may have been obtained illegally? Are you doing those things, or are you feeling like there's some financial impediment where you say, I don't get paid enough to do this, and so I'm not going to do it? Another way to measure it would be the success of plea bargaining. That gets tricky because you don't want to say that just because the defense was able to get a good plea bargain that is necessarily a good outcome for the system as a whole. You have to take each case as it presents itself. For some people, a plea bargain is a good outcome. For other people, there may be other considerations at play there. So it's difficult to judge it, just by my client was found not guilty, therefore I succeeded, is in my opinion a good thing to look at, but it's much too simple, and you can't judge an indigent defense system based on conviction numbers.
One more, Commissioner Moss.
Maybe more. Well, I would think that if you have a appointed attorney who doesn't do anything, you call the Bar Association, you have effectiveness of counsel arguments right there. But I'm just interested that the metrics that you would use to oversee a extensive program, which this is an extensive program, and if it's sort of like, well, we got to look at each one on a case by case, that's not sustainable. You can't have that many oversight officers watching every single case and making sure that every single lawyer did every single thing. You're going to have a set of metrics. I'm just curious. I do understand saying we need to pay them more and get more of them to do it. I mean, I get that. What I don't get is how you're going to ensure quality representation other than getting more expensive criminal lawyers because they, you're going to get Jeffrey Feiger or whatever, but not me. No, I haven't done those kind of appointments for 40 years, and I don't intend to start now. So the deal is that I'm just kind of pressing you on it because that is an important component of what it is that you're using as a metric.
Well, it is, and I think part of the issue that we're facing right now is Standard 7, MIDC Standard 7, which deals with attorney oversight. Although that has been proposed by the MIDC, it has not been adopted by LARA, so it's not something that is mandated. It's not something that we are given grant funds to do. Standard 6, which would get into another metric, would be attorney caseloads. So are you doing too many cases in comparison to national standards? You're running them through, yeah. Yeah, and that's a much easier metric to look at the whole. And it is something that we can do on a limited basis currently, but that's another standard where the MIDC has proposed it, LARA has not passed it yet, and so we cannot get grant funding, to create a robust system with that kind of granularity. I think I'm hopeful that in the next couple of years, LARA will approve those standards. But the attorney caseload standard, quite frankly, is going to be a very expensive one for the state. People worry about the hourly fee standard, and that's going to be expensive too. But the caseload standard, in my opinion, is going to be even more expensive for the state.
That's very sure. Being that, Commissioner Cole, we were sort of present at the creation of this, so I noticed the budget, the escalation of the budget. I notice, you've question. But this is really open-ended, isn't it? I mean, it's not like you can say we're going to expect to, like a lot of these other budgets, all things being equal, which of course we know they won't be, but let's just assume for the sake of argument that you're not going to have vast increases in percentage or in amounts. But here, geez, it's like 9 million, it could be 10, it could be 11. Is there any upper end at all that you can see of this?
Well, I think this slide speaks to that and the next one. I mean, we are a two-part budget funded by partly county general fund dollars and partly state grant. And so our local share, which is our statutory requirement, is something that is set each year. It can only go up by 3%. It's based on the average of fiscal years 10 to 12, and it goes up each year by either 3% or CPI, whichever is less. And so that local share calculation, and I think the statute as enacted was designed to significantly benefit local government because that amount does not compound. Our original local share, as you can see here, was 1.8 million, give or take a couple tens of thousands, right? The highest it can ever be under the current formula is 1.8 million, give or take another few tens of thousands. It cannot go above that bolded number that's on the screen unless there's a legislative change. And so from a county perspective, that local share that we have to put in, that's the highest it can ever be unless there was a change in the law. And of course, a change in the law would bring about potentially heavily concerns and unfunded mandates, et cetera. I do think that there will be a significant uptick in budgets from a state grant perspective. There's no question. I mean, our grant this year is approximately $6 million. The grant that we are requesting from the state next year is over $14 million. So us alone, we've more than doubled our grant request from the state. We're waiting for approval from that. for that. We probably won't find out until the October MIDC meeting whether the state has approved that or not. But the signs that I'm getting are that they're very receptive to our proposed plan changes. They're very receptive to the changes we want to make in our system. And I'm very optimistic that we're not going to have any major issues getting this grant funding. So that's the piece of it. The state funding piece is the piece that will continue to rise, yes, in future years.
Is there a cap, or is the state funding required or discretionary?
Well, it's required in the sense that if the MIDC approves a compliance plan, which we're required to submit every year, they are required to fund what they have approved with grant money. If they do not fund it, we are not legally required to comply with the MIDC standards.
It's like revenue sharing.
In some ways.
Yes. How well we know. Thank you.
Thank you, Commissioner Moss. Was there more you wanted to?
Well, I think that point was a good one, a segue into the fact that we really are a two-part budget. We have our county local share. We have that amount of money that we know we have to put into the system every year. And then we turn in our compliance plan to the state. We tell them what our plan is for the next year. They review it, and we tell them how much it's going to cost. I was in front of Finance and Public Health and Safety a couple months ago for our grant application when that was submitted. So that's the same thing we're talking about here. The numbers have changed slightly, but our grant is designed to really look at three major buckets and then a couple minor things. The first thing is funding of our current employees. The second is funding to start a new public defender's office. And then the third is to increase the rates paid to our current independent contract attorneys. So these are the employees that are funded by our current grant, and we expect that these employees will continue to be grant funded. This is my position as the chief attorney, and then 8 other positions within my office. The grant also funds 2 community corrections officers and 1 7-day-a-week corrections deputy position. Those positions were funded really as a result of MIDC standards that required counsel at arraignment, which had not happened until about a year or 2 ago. And so because we're now providing an attorney for everyone at every arraignment, we need more, it requires more deputy time to coordinate those communications, because of course the attorney has to talk to their client. And it also requires more community corrections time because they're preparing those pretrial services reports that they then have to distribute to an attorney, which they never had to do before. These would be the new employees. So when we create the public defender's office, these would be the new employees that would be created. We would have a chief public defender, a deputy chief, 2 principal attorneys, 2 senior assistants, an assistant. And so those are various levels of expertise. Those are commensurate with the prosecutor's office. So when you see a classification here that says principal attorney, there's a classification in the prosecutor's office that is principal attorney. Those 2 people would be paid the same. That's a key. You don't want a system where your prosecutors are getting paid more than your defense attorneys. Same with senior assistants. The pay is going to be the same. And then, of course, you can see a couple of support staff in there as well. The reality is that these people probably won't be fully in place until the spring. By the time you hire, make sure you have the right people hired, make sure that you have a place to put them. They're not going to be up and running until the spring of 2023. This would be the personnel portion of our grant funding is approximately $2.6 million. And we're looking at space. We think there's some good space in the South Oakland office building in Troy. There are a lot of advantages to housing a small public defender's office down there. There is pretrial services also in that building. There's results drug testing in that building. Veterans has a satellite office in that building. So there are things that people would be able to do. They're coming to meet with their public defender. They could also accomplish other things that they may need for, not only for their criminal case, but maybe even for other facets of their life as well. So we do think that'll be a good place to start this office. We don't think that it's going to be sustainable as the office builds. We want people up here in this building. We want people in Pontiac. We want people spread, throughout the county. It's just waiting for that. I don't know how many times I've heard the Plant Moran study mentioned during these budget hearings, but it's waiting for that Plant Moran study to say, hey, is there going to be space in Pontiac where we can house a larger office as we build that out? As far as our independent contractor attorneys go, we're going to increase the rate of pay for capital cases. The MIDC standard says that we should pay $120 an hour for capital cases. So that's anything punishable by life. And so we are going to do that. And then we're on the non-capital cases, we're going to increase the fees that we pay. They will not strictly be hourly, but they will be increased so that they are giving the attorneys something that equates to a reasonable hourly fee. And then our hope in future years is that we get all of those cases hourly. That's the ultimate goal. We pay all our cases hourly, but that is something that we really need to look at. The data coming out of the last 2 years in COVID, it's very difficult because you can't say, well, what the court did last year is what the court's going to do this year. It's going to be a lot more. And we need to be able to convince the MIDC that, yes, our need, if we're going to pay hourly for all non-capital cases, our need is X, probably, I would say, $10 to $12 million. But we need to be able to show them the data. And I'm hoping that as we go through next year, as the court has returned to regular operations, that we will be able to do that for FY24. We're also increasing our grant request for experts and investigators. This has been a major change in the system in terms of how attorneys access expert and investigator funding. They used to have to file a motion with the court. That is cumbersome because not only do you have to file the motion, you've got to come in typically on a Wednesday to argue it. So you got to take time out of your day to argue it. You are tipping your hand in some respects to the prosecutor. The prosecutor doesn't have to tell anyone when they hire an expert. They just do it because it's in their budget. But the defense in the past would have had to file a motion and sort of tip everyone off that this was happening. The process now is way better. They are reviewed, all requests are reviewed by my office, me specifically. I turn them around. My goal is within 24 hours. Usually it's much quicker than that. I have only denied thus far a couple requests, which were just way above and beyond what was reasonable. And even those, we worked with the attorney to get it to a level that was manageable. And so we've been able to get a lot of that funding out the door that previously they would not have been able to access. And so this is really just a request to beef up that funding next year. The process is still in place, and it's a good process, but we just want more money for that. So that's the end of my PowerPoint presentation, and I'm happy to take any questions.
Okay, I'll open it up to the commissioners. Commissioner Cavell.
Hi, Pete. Just to make sure this is clear, because I'm sorry I walked in a little late and there was a back and forth, but two things. One, the county general fund will not put more than $1.8 million towards your, hopefully, $15 million budget. Or 14.4 plus 1.8, whatever that is.
I want to make sure, because you said will not. No, no one is refusing to do that. That is our, that's what the statute tells us to kick in.
That's okay, yeah. Right. We love this, but just to make sure,
Yeah.
because I'm trying to say that this is a great ROI. Right?
Yes.
It sounds like a 7X return, if
Yep.
you're thinking about just in money terms. And then looking at your org chart, you have one staff member paid for with Oakland County taxes and 9 others paid for with state grant.
Correct.
Okay. just want to make sure that that's, okay,
Yep.
thank you.
Thank you, Commissioner. Anybody else? Commissioner McGilvery?
I read someplace here that you're going to have an office at the Troy building?
Correct. The plan would be to start the public defender's office because we have to find space for these people. The plan would be to start that office at the South Oakland building in Troy. There's some space there that we've looked at with facilities that we think would be appropriate. Ultimately, we would want to expand and be up here, but we need to find the space to do it.
Okay. The reason I bring it up is I've been in that building, and there's not much space available.
Right.
That's why I was curious.
Yeah, well, the setup would be sort of in the southwest corner. I don't know if you can picture it, but it's southwest corner, and it's a room where we would have some cubicle setups, and then we would be able to access one, possibly two enclosed offices. There's another conference room that we need to talk with IT about. It's a Clemis training room. I'm not sure how frequently or often that room is used, so I need to talk to IT about whether we might be able to reconfigure part of that space.
Okay, thank you.
Commissioner Powell?
So with the fee or how we're paying these attorneys, do you feel that our rates are within the competitive range? Or if not, what is that rate? Like,
Yeah.
what is that right now? And, oh, wait, one more thing, it's a two-part. The inflation bill that I think that federal is signing, or the president supposedly put a cap, or he's doing, I don't know what's all in that. And if you have been able to review that, do you feel that that'll kind of help us in our retaining or getting, better attorneys with this price competitiveness?
Yeah. Well, I would say that our current rates, I don't think are competitive, and that's why we want to raise them for next year and beyond.
Okay.
The MIDC Standard 8 rate is what all systems sort of use as a guide. So that's that 120 an hour for capital, 110 an hour for non-capital felonies, and then 100 an hour for misdemeanors. That's really going to be, from a state perspective, they're not going to allow us to pay more than that unless that Standard 8 changes and
Okay.
goes up with inflation.
Okay.
But even that, I mean, we are not, we are really not even close enough to that rate right now, which is why we're trying to make these large changes for next year.
Wow, okay, thank you.
Thank you. Commissioner Cavell, one more time?
Yeah, and you brought that up. I feel like I heard this from an attorney, and I might be misremembering, but capital cases, you used to get like a $1,200 check for the whole thing or something, right? Or what was that?
Yeah, yes, theoretically, if it was a waiver of exam, if it didn't go to trial, because there are other fees, for trial, there's some fees for jail visits. But yes, the base rate for a capital case was about $1,200, yeah.
So then the attorney would, right, they would want to spend 10 hours or less to get the same amount of money.
Right.
But this is about someone's life and a lot of things to figure out. Okay.
Right.
Is there anything in your budget that, either from the state or locally, that you're wishing you had? Because I heard you talking about Standard 6 and 7.
Yeah.
That there might be a lag. Is there anything there? Or, we have ARPA money that we're looking at. Has COVID impacted any of this implementation or rolling out?
Yeah.
And does that affect you at all?
Well, I think the general answer is there anything that we wish we had? Yes, from the state, certainly. I think the problem is how we quantify that, especially as we go through the next year. I can tell you that I would love for the state to write me a $30 million grant check and say, I'm going to pay all the cases hourly. Right? And then at the end of the year, because our grant is an unexpended funds grant, so whatever we don't spend, we have to return to the state. They don't like to have a huge amount of unexpended funds because the state doesn't want to give us a bunch of money that we're not going to spend. So there's an inherent conflict there where I would love to be able to say, listen, I can't tell you what our caseload's going to be next year because we're dealing with all this COVID backlog. But if you gave me $30 million, I can pay everyone hourly, guaranteed, and I'll probably still be giving you about $7 million back at the end of the year, right? They're not going to do that because that's not how the grant works. So are there things I wish we could get or I want? Yes. Are those things that the state is going to give us realistically? No, probably not.
Okay.
Thank you, Commissioner. Anybody else? I just want to say that I would expect next year that you would have more specific KPIs on things like how much money we've spent, how many people have passed through the system, how many lawyers, just what are we measuring to see year to year? Is our performance improving? I understand you're new. You don't have all that yet, but that would be one thing. The other departments are coming with that, and then it's measurable things that we all understand the language. Yours, you're not quite there yet, but I would expect next year you would have some more firm kinds of KPIs that you're evaluating.
Yeah, we talked, I mean, that's a great point, Commissioner. We talked a little bit internally about the KPIs because, all the departments have been going through KPI training. There was some sense from the organization that was doing the KPI training that a department like ours was a little different and now was not, this year was not the time to be doing that. But I take your point, and I understand it, and I think especially as we develop the public defender's office, and as we implement these new rates, I understand what you're saying.
And you were, I don't know if you were sitting in on the previous one,
I
but
was.
yeah, there are things that are highlighted that at some point we're going to want to change. We're going to say we're not doing this well enough, or we're not reaching the right population, or whatever. So they're an important tool, but yeah, the fact that you're not really in the position yet to know what those are yet is understandable, so.
Right. Well, and I would also say, just as we think through that, we do need to be careful about recognizing that the mission of the division and the grant funding is to provide indigent adult defense. And so while there's a lot of good things that we can learn from our data, we also don't want to stray too far into developing KPIs for things that we can't legally do under our grant, is all I will say.
Exactly. We just want to make sure we're doing this job well.
Yes.
Because I think everybody agrees that we want the system to work.
Yes.
So,
Yep.
good. If nobody, Commissioner Charles, I checked a couple of times to see if you had requested online, but you haven't, so.
I have not.
Okay. If nobody else has any other comments, then I guess we're finished with the Indigent Defense Services Office. Thanks
Thank
for
you.
coming in today.
Thank
Thanks
you.
for all your information. Cool. All right, we'll take a couple of minutes for staff to make the adjustments they have to make.
Okay.
Let's start the prosecuting attorney at 4 o'clock. Okay? Does that make sense?
Yeah, you still have
Online,
Yeah, and Yolanda's here, I
Okay.
think. Are you still here, Yolanda? Yes, she is.
I'm
Okay.
here, just a slight delay.
That's okay. Thank you. All right, we're going to get started with our last group of the day, the prosecuting attorney and her staff. Welcome.
Welcome.
And we're going to let you go through your presentation, and then we'll have questions.
Okay.
So.
I just have just a brief statement, so if we could just wait till the others are here, that probably would be better.
Sure.
Who are we
Chuck-
missing? Just
We're missing Chuck and Yolanda.
okay.
I mean,
No,
not Yolanda,
Angela.
Angela.
Commissioner Powell.
So, and Yolanda's behind you on the screen.
Good
She's up there in terms of the, right, is that where?
Yeah, she's up there.
Commissioner Charlton is the.
Oh, right,
Nice to see
okay.
you.
Yeah, she's not facing us.
No, we're, and I don't know where Miss Commissioner Moss went.
Yeah, maybe.
Yeah, he'll be right back.
He doesn't normally wander for too long.
No.
Madam Chair,
Yes, ma'am.
I was just going to say that left microphone, the lady sitting next to prosecutor, sometimes that microphone is so light. Just wanted to make you aware.
Oh.
Thank you.
That's Betsy.
Yeah, just, everybody make sure the mics are up close. That's been kind of a issue through all of these, so.
Okay, I guess I'll just.
He'll be here.
Okay. All right. In preparing for this, I reviewed last year's presentation, where I was sitting here about a year ago, and I had a thought that I have frequently, which is that presentation was before Oxford. Since November 30th, 2021, everything about my job, our office, and my life candidly has been defined in terms of before and after Oxford. For that reason, I hope you allow me to yield some of my time for the budget and address something that is far more important, but of course impacts our budget. Within hours of the shooting, it was abundantly clear that we had no infrastructure or protocol for this size of a catastrophe, and that what people of our county needed most was information, transparency, and communication from their elected officials. I immediately reached out and asked for help in crisis management. I needed a specialized team to handle press, messaging, and outreach. Both the county executive and the board approved it and provided it. I believe this was instrumental in the aftermath of this tragedy. Within days of issuing charges, I was met with significant threats to my life requiring round-the-clock security. My investigators reached out to the sheriff's office and the county leadership, and it was provided. I couldn't have done my job if I was living in constant fear of my own safety. Soon after, we were able to assess what our own needs were to effectively prosecute this case. This required a major allocation of resources. This commission acted swiftly and with no concern about politics. That request was appropriately reviewed and scrutinized, as is your duty, but it was provided in a time frame that made our job so much easier. We needed a safe and secure network to store highly sensitive and confidential information. County IT worked with us and made it a top priority. We needed faster computers and a dedicated team, including paralegals and investigators. It was provided. I say all this because despite the fact that the last 9 months have been some of the most difficult for me, both professionally and personally, I have never been prouder to be a citizen of this county. As leaders, we all work together, as we should, despite where we came from or what letter was after our name. I did not feel alone in it. I felt and still feel that I am privileged to both live and lead in this county. The point I'm trying to make is one of gratitude. I thank each of you for your dedication and support and your service to this county. We have requested, in my opinion, reasonable and appropriate budget increases that are in keeping with the proposed budget. Digitalizing our documents and cases remains a crucial need and an ongoing project. We are doing our best to achieve this without additional budget increases, but expect that more resources will be needed. We strive to retain and attract good candidates in a very challenging climate. Appropriate assistance to processing, storing, and distributing the ever-growing volume of digital evidence is essential to retain assistant prosecutors so that they can spend time being lawyers and ensuring public safety rather than processing digital evidence. Once the full digitalization is completed, our goal is to focus on outcomes of data gathering so we can determine where racial disparities exist, as well as free up time to devote to assistant prosecutors at arraignments to reform our wealth-based bail system. I will refer questions to my team, David Williams and Betsy Haig, the three of us, I want to just note, spend significant amount of time at every moment of every day, 7 days a week, and we are dedicated to making sure that we are running as efficiently as possible. I do need to note that the current litigation, where I'm listed as a named defendant in the litigation sought by the governor after the overturning of Roe v. Wade, has taken a significant amount of our resources. Along with the daily demands of prosecuting those responsible for the Oxford shooting. Multiple civil attorneys in cases and 2 prosecutions requires an enormous amount of time. This occurs, of course, on the top of the daily tasks and duties of running our office, and the nearly 6,000 warrants that have been submitted and reviewed since January 1st, and the nearly 5,000 that have been issued since January 1st of 2022, just in this calendar year. My leadership team, the 3 of us mainly, work literally around the clock 7 days a week. I think I can speak for my 2 colleagues when I say these are challenging times to lead, but we feel privileged to do it. Thank you.
Well, thank you. I will, at this time, open it up to the commission to ask questions, make comments. Commissioner Powell.
Does this budget provide the prosecuting attorney's office with the necessary resource to achieve the electronic document retention goals of the office?
So, what our
Please pull the mic up close.
Pardon me. What our
Thanks.
office needed were 3 things. We were operating totally with paper files, which is no way to run anything, and it's not secure, and you can lose files. Yes. So what we needed was 3 things. We needed document management, evidence management, and case management, which all sound similar, but they're not the same. Fortunately, the document management is being addressed through the rolling out of Laserfiche throughout the county, and we're on the cusp of having that. They had to set it up for us, test it, but we're about to have that. So document management is taken care of. When Karen said, look, we cannot delay going paperless, we worked with IT, who's been great, who came up with an interim solution. It's a SharePoint site. We call it the Q Drive. It means all of our prosecutors can access all of our files from anywhere, including on portable devices. That is it's a little bit of a makeshift solution. That right now is acting both as our evidence repository and as a rudimentary case management system.
Which we needed to implement quickly, and I finally just said, we're doing it. So I was here at 7:15 in the morning on July 11th, which incidentally was my birthday, and the best present ever. And personally there when the first electronic warrant was submitted and said, if we don't create paper files, then there won't be them. But this is a makeshift. And the other thing I want to say is this is just what every prosecuting attorney and district attorney's office in the country has. We do not until July 11th. And I won't go into all the reasons why it was really a crisis, but we can't really serve the public without it. So we are doing it. We are not doing it. It was a makeshift solution that David actually has been very instrumental working with IT to create.
And so you asked the question, do we have what we need? We don't have those things yet, but we've been working with the county executive's office to identify ARP funding for the first initial chunk of that, because it's very expensive to get the case management system at the beginning.
What's very expensive?
It's like $600,000-ish. They're going to have 659, I think is the number, but they're going to help us identify funding for that. But then there's an ongoing expense, and I want to say it's a little over $1,000 an attorney. I want to say like $110,000 a year. So we wouldn't need that in our 2023 budget, but we will need that going forward.
And also, just to look, we're doing the makeshift, and it's working. And this was a deliberate timing issue for me. I came here last year and asked for a lot more money, and then I came 6 months ago, 9 months ago, and asked for a lot of money for the Oxford prosecution, and I'm mindful of that. So we're doing the best we can, but it is critical. I mean, it's very important. This is not a question of when it's provided. It's going to have to be provided if we want to actually just get up to speed with the rest of prosecutor and district attorneys' offices. I don't know if I shared this before, but we've been hiring prosecutors from across the state, much to my other prosecutors' dismay. But, you know, I will welcome them and say, hey, how do you like Oakland County? You know, we're so advanced, and what do you think? They're getting paid more. And across the board, they always say, this job is so much harder because there's no technology. You don't have digital files. They had those in Bay County. They have them in the Upper Peninsula. They have them. So I don't want to, you know, we're doing the best we can, but this is going to be an issue. So this is.
So, okay, that sounds like, okay, well, you said 600 to implement and then 100 every year from there. Last I knew, we the third, ain't we the third richest in the county? This is a need, and I'm gonna just say this, I'm very frustrated with what I'm hearing coming from all of our courts. Be it with the customer service that we provide, the reputation we provide, and yet we are like at the bottom of the bottom when it comes to our courts and processing. And the reason why I'm irritated even more is because that's dealing with people's lives. That mistrack of a document can cost somebody life in a split second. You know what I mean? So why isn't it looked at or treated as a priority? And we knew our prosecutor has been very transparent with us in what she came into, because our last prosecutor didn't have her shit together. And that department was not together. And anybody that is questioning, if I had caught a case, I would have been up and down Oakland County trying to figure out for them to recheck, fact, everything, because her office was not up to speed. So now we have a new prosecutor, and I'm hoping everybody hear how I feel. And she's asking for what she's asking for, and in my personal opinion, is not a lot of money.
No,
for what we spend. Just let me say, I know you got to be fair. I don't have to really be fair when we're trying to advocate for departments to be brought up to speed to do their work. And again, I say this all the time, I'm about support staff. If we cannot give them the tools to really do their jobs, we have a problem. So I'm going to strongly encourage our executive team and us commissioners to revisit and understand everything that this prosecuting attorneys need, because she came into a haphazardous issue anyway to where she was not up to speed. So please, can we help her? And I'm sorry, I just had to do my rant.
Oh, I appreciate that.
Frustrating, because you're not the only thing. We got the delay with IT, we understand. We got the delay in facilities with certain things. And now we back to this tech issue, which is we know that that's a demanding thing.
Being in the unusual position of leaving one department of the county as a circuit court judge and then going to the prosecutor's office as the elected, it was night and day. Night and day. I mean, as a circuit court judge, court administration was properly on top of building needs, advocating for resources, and then when I was the elected official, I can hardly get people on the phone. I think it's a lack of 12 years no advocating for resources.
Oh, okay.
So I do think it's really, how do you don't know what you don't know. You didn't have anybody advocating for the prosecutor's office, which is really important. But again, you know, also, if anyone's wondering about this specific issue, Commissioner Spiz, we toured him around within the first, 3 or 4 months. And he's the one that pointed out to me, I hardly knew him. Unfortunately, we've gotten to know each other pretty well because of this tragedy. But he said, look, what are you going to do if you have a fire? What are you going to do if you have a flood?
Probate that. Didn't we just ask probate that last week?
And I said,
oh, the clerk.
I won't repeat what I said, but basically, we're all out of luck because this is a problem. But we're going to fix it. You're right, we need the
I
resources.
just want to put on record that you do have a commission. Our ears is open, especially finance. I could just look at some of our faces, and we're kind of devastated here. So at least I know that we're listening, and we have been team players in making sure our departments, rightfully kind of get it. I do know some of us with the budget understanding and finance, which I lack. I will say that for the record, but sometimes I just feel like certain things is an urgency in order for our support staff to be able to do what they need to do.
A good example of that, to be honest, is I look at all of your iPads, and you have stands, and you have electronic access to all the documents that you had to prepare today. Until recently, assistant prosecutors walking into courts with their documents, with their files, it called for boxes and boxes every day. They had no electronic database to even look anything up. Until July 11th, when we said it's going digital, and not all our, we haven't done that to the existing files, and now we're just now getting them laptops, so now that they can go into a court and have an iPad or a laptop and be able to access something immediately. I think it's not an issue of the county not because there's a disconnect between what we communicate to the public as Oakland County being so advanced. In certain departments, you are. But it's not uniform throughout.
We totally agree with that statement.
Because don't you want your assistant prosecutors to have something so they can have electronically?
We want every department to be able to operate and do their job. Across the board, we don't care who at the top. Every department should be able to give great customer service and assist anybody coming in this building to do a job, period. Sorry, I'm done. Thank you, Chair.
I'm not sorry. Thank you, Commissioner Powell. I have a question about and I'll just throw it in now because we were talking about it. So I was speaking to a circuit court judge a few weeks ago who was telling me that their case management files, that they go somewhere else out of state and they have to bring them back, and it's a big time delay. Is that related to what you're talking about, or is that a different situation?
That's a different situation. I
Okay.
think they have some of the same struggles, but they're a few years ahead of us in terms of
Okay.
some of their electronics.
Okay, I'll talk to them
They're-
about it.
They
It's just-
they are. Court, again, being a former judge, court admin really does, and the court IT part, they really do know what the problem is if you ask them. Different judges have they see slivers of it, of what the problem is. But in general, when I was a circuit court judge, if I asked for something, I received it. If I wanted my paperless files. I didn't want files, and I was one of the few judges, and I wanted to electronically prepare. So I was provided with that.
Okay. So they're not really related. Okay. Next up is Commissioner Charles, followed by Commissioner Moss, and then
I'm gonna go a second time.
and then
I gotta-
Commissioner
I gotta-
Cavell, and, okay. So
Good
Commissioner
comment.
Charles, floor is yours.
Terrific, thank you. Prosecutor McDonald, I just want you to know I'm super jelly at your birthday being 7/11.
7/11/70, actually.
Oh, nice.
Yeah.
Do you get a free Slurpee every year?
I think everyone gets a free Slurpee on 7/11.
Yeah, we all get them.
Yeah.
You mentioned, again, the sobriety or the sobering moment of thinking about last November is certainly not lost. And thank you for just always lifting that to remind us of just what we all faced. And you mentioned how, and I'm paraphrasing you incorrectly, but basically the department was kind of out of the scope in terms of the needs for handling such a crisis such as that. And I'd love for you to expound on that. And the second and final one that I had was, I think you talked about it for a moment, but I was curious about your fire suppression and backup power supply abilities. So I think you just touched on it, but if you wouldn't mind succinctly just letting us know where you are in need of that.
The first, I'll address the first question. There's a difference between having someone in the office who knows how to organize a press conference and somebody who's skilled in crisis management, which it took me about 48 hours to realize. I called David Coulter immediately. Look, I'm going to need somebody. I didn't really even have a true comms person. We didn't have that. So he said, well, our comms person has some time, and it was a few hours a day. And it became, we were getting hundreds of calls. And remember, when that was going on, there was just a need from the public, not just here, but all over the country, to know what is going on when the details were released. What are you going to do about it? That was so important. And that starts with with communication and transparency. We had no idea how to organize and communicate with hundreds of media outlets, national, international outlets, absolutely no clue. We had no idea what language to use that would communicate what we needed to, but not in a way that would cause more panic or be concise. And so that is what we needed. So we were able to secure an outside firm, local outside firm, for a very short period of time that had those connections and knew what to do and how to do it. I mean, we had hundreds and hundreds of media requests. So crisis management, I don't know what the county has now. I know that there was not a crisis management resource for us to access, which if there isn't something like that, it might be interesting to look at. Then we were able to transition into just a regular news media person who could issue releases. We're lawyers. We are lawyers. We are not skilled in that. I mean, I'm becoming, unfortunately, more skilled than I want to be, but I still don't have the time, nor does David or Betsy, to issue press releases. That's not what we're really paid to do. So that is what I'm talking about. We, for the most part, I think have filled those gaps, but that, look, I hope we never, ever, ever need that again. I hope nobody in this county ever needs that again. But when you are dealing with media and then thousands of people in the public who are terrified to go out in a group setting, you got to be prepared to address that, to calm fears and give information. And then in terms of the second question,
So that's an interesting question. We had a fire alarm the other day. Someone said, I kind of smell smoke. The fire alarm's going off, and everyone leaves the building. And then it went off, and people went back in the building, and no one seemed to know exactly what happened. That's a facilities thing. We sort of took that as, I guess that's how it works. But I really don't know about our fire suppression system, and I guess I do have concerns. It's just not something we've, frankly, taken up or addressed.
No.
Well, since all your records are paper.
Can I tell you? Yeah. Fortunately, every case going forward is not paper, so.
Commissioner Charles, you had more comment?
Just to close my moment here with just saying I hear, we had our emergency management folks here last week, and to me, crisis intervention or crisis planning and things like that seem firmly placed under that department. So I'd like to follow up with that since we still have some time with these hearings. And then facilities. So those are the two takeaways that I got from those responses as Dear Aaron is capturing some of these things. Thank you.
Right. I mean, there's a crisis plan and emergency response in terms of what we do for public safety and infrastructure. But when it involves a mass tragedy like that, you have to communicate and get with victims, essentially, and that's a different thing.
We're a big county, 1.3 million people, and it's reasonable to assume we're going to have another tragedy someday.
I mean, I think everybody here knows on that Friday night what happened in Oxford when they tried to have a vigil, and County Executive Coulter was there, and there was something went through the crowd, and there was pure panic. It took the sheriff getting on stage to try to calm people down. That's exactly the kind of thing that we are aware of, because we've had people who are more skilled inform us that the words you use really matter, and issuing statements that cause more questions than answers does not promote safety. So that's what I'm referring to.
And I just want to add that we had these very significant, immediate, short-term needs which were funded. So like this PR help with press releases and press conferences with, dozens of cameras. We got help with that, but as quickly as possible, we got away from having to use that outside help. We needed outside security, and with the Oxford MR funding, we were able to get someone to do security to take it off of the outside payroll. So we've
actually just stopped wanting to use a driver because I was so cognizant of how much money it costs. So then we decided it was cheaper if we hired him as part of our investigator, so that it's just more cost effective. Because, yeah, I mean, for a period of time, it was intense. So
we've been very cognizant about not asking for positions if we don't really need them long-term,
Right.
about filling those gaps with this emergency funding we got. You'll notice we've not asked for any new attorneys for Oxford or for this year. One of the things we've talked about, we have an issue in the office right now of a backlog of cases, and people have said, we need more people, and Karen has said, stop. If we need more people, we will go ask for it. But the first thing to do is figure out where the problem is. So our go-to is not to come to you and ask for positions or money. It's to figure out what we can do with the resources we have and make sure when we come to you, it's something that
because
we
the
really
goal
need.
with the digitalization should be freeing up resources. So
Okay, Commissioner Moss is next.
Thank you. Well, first of all, Madam Prosecutor, thank you for coming here for all that you did during the tragedy at Oxford, and appreciate, obviously, that's taken a toll, and I appreciate that you've come here and shared that with us. So thank you again for all you do and all your staff has done. I guess, looking at the budget, clearly there's obviously a spike in expenditure because you're dealing with the crisis. And now that crisis hopefully is over, and you need
the trial is probably going to be in January of 2023, and I've stopped using the words "when this is over" because it doesn't look like it's going to be soon. So, yes.
Okay, well done. And sort of, I've got three. This is the first. The second is I don't want to use the words deficiencies, but when say the equivalent of a war comes, you find that there's things you didn't know, didn't think about, and have to consider, and the response to crisis that you're talking about. These are simply deficiencies you don't know until you have to deal with them. They're well put and they're well diagnosed, and I see going forward on even county level. Third, I have a question about digitalization. You said that there are lots of counties that, like Bay County. I mean, I'm from Midland. Bay County, for God's sake. How about Wayne?
What's that?
How about Wayne?
So Wayne just got the exact system that I described that would cost us this $659,000. They launched, I think, in the last.
But they were digital before that, and they have a litigation support division in their office that they've had for we've hired Wayne County, a Wayne County prosecutor. He's on our team of how to help us digitalize because he's been at Wayne County. Yes, an underfunded county has more resources than we do. But again, I'm not all about.
Thank you.
It's terrible, terrible, terrible. I know why, and we're working to fix it. But I just want to be as completely transparent as possible. And we've extended this invitation at any moment. Anyone wants to come over, and we'll show you what we've done with the money you've given us. I think you'll be happy. And then also what we're really talking about.
Macomb? Does Macomb have it?
Yes, Macomb has
Okay, so all the biggies have it. We're not
Yes.
talking about simply the little ones.
And Kent County.
Excuse me.
First.
Thank you. If only it's not just the smaller ones where you have
And
the
Washtenaw,
economies of
yeah.
scale.
Yeah.
We're talking about the biggies. And
Yes.
There's nothing bigger than Wayne. There's nothing bigger than Wayne. So.
True.
Okay, so we are really lagging in our own weight class, as it were.
Exactly.
Okay. Great. Ms. Powell, Commissioner.
I'm over here I'm all done about this.
Well-
We're a very competitive county.
Oh, yeah.
Yes, I know.
I don't like that. All three before us months, we got to do something.
We've got, yes, we do, which is why we're talking with the prosecutor here about it. So anyway, right. So anyway, it's like I said, it's sort of shocking as we've had a parade of people coming in the budget about how they're doing fine and they want to do better, and they're doing fine and they want to do better, and they're doing fine and or they've got this or that should be remedied, but the distance that needs to be made up is disturbing. So thank you for coming, and once again, I'm sorry that it takes such a tragedy of that magnitude to expose the need, but.
I mean, the digitalization, to be fair, was clear since day one. But I mean, look, I took office, and this is just has to be said. After the primary, the prosecutor was never basically back in the building. There was no leadership. So that's from August until January 1, there was really no attempt to fill positions, no leadership, nothing. No transition. When I asked for any information, they said it didn't exist. I mean, I'm not one of those people who talks about how hard my life is, because I feel like, based on what we do every day, I'm blessed. But there were some significant issues. There was COVID. We had prosecutors being trained remotely at home without really good technology. I mean, there were a lot of the carpet was ripped and stained in I mean, there were typewriters and VCRs everywhere. I mean, it was a problem. The digitalization was on the radar, but I was aware that Laserfiche, we would just continually had been put at the bottom of the list at the request of the former prosecutor. So I thought Laserfiche was going to be the answer, but it just was not coming. And I formed an internal task force immediately about how do we digitalize? Well, assistant prosecutors have been doing this for a long time, and they weren't like super excited to give up paper. People aren't, right? And so, right, exactly. So there was a really kind of serious event that led me to believe, which was about 500 files were brought to my attention that had literally just been living in people's offices and boxes, and they represented misdemeanors that had been dismissed, many of them domestic violence, and there's no way to track them, so nobody even knew that they weren't being turned in, and memos were supposed to be writing, but they were overworked. And the point is, I didn't sleep that night because I thought, you know what? These are victims. Each one of those people are victims, and I know we've got this tragedy going on, and I know there's a lot of other stuff, but I can't wait. We're not waiting. And so I came in and I said, we're going digital, and it's going to happen Monday, and it was like Wednesday. And I knew we had the workaround, and I knew we had the structure, but everybody wants to wait and wait and wait and wait. And finally I said, no, we're doing it. And it was difficult, but
It's actually gone pretty well.
it's gone pretty
The
well.
prosecutor was there, as she said, on her birthday the first morning
I
before
did.
everybody else.
I did. It was there.
The poor receptionist.
Yep.
turns
Wasn't the
around
best
and
day
there's
for them.
The prosecutor at her shoulder at
Right.
7:15 in the morning. But it's actually gone very well.
It has. People don't like to change, but so did the crisis put a highlight on that? Yeah, and here's actually, you're right. This is something I have to say. We received the assistance in Oxford when we needed it, and we got a secure drive, and everything was stored digital. There's no paper file with the Oxford cases, either one of them. So I knew it was possible, and I knew I was working with it. I'm personally prosecuting one of those cases. And so once I had our team, and I said, this is possible. We just need a workaround and a place to store our files. I can't wait around until we get our millions of dollars for this. And that did help me realize we got it done in Oxford, right? So if we can get it done in Oxford, I thought we can get this done, and that is what we've been doing. But it's just a workaround at this point. But it's better than what we had.
Redundancy in your storage, I would hope. Having had hard disk files of crashes of my own that
Yeah.
I don't even talk about it.
Yeah.
So yeah, but good. All right.
Thank you for your question.
It's I'd say tough coming into the 21st century. I guess you have to come into the 20th first.
Yeah.
Hey, I do some printing. This was paper.
Well,
but yeah, we're all on our own journey. So
I still have monks transcribing
that.
stuff.
yeah.
Okay, you done, Commissioner Moss?
Madam Chair, I yield the floor.
Okay, next up is Commissioner Cavell, followed by Commissioner Powell.
Hey, first about all this document stuff, you have an ARPA request, if I read that right?
Yes.
Okay.
Yeah,
so-
he's just talking about that.
So this is something that is being handled
Yes.
in process, something we should look forward to seeing in the near future.
That's right.
Initially, but then going forward, there will be monies that we have to get into the budget to sustain the system.
The 110K a
Yes.
year? Okay. So, it'll be fixed. Okay. Kind of shifting gears a little bit. Do you experience many cases of wage theft? And those sorts of things? And if so, how do you work on those, if at all?
We have not. We have not, and I'm not going to give you some political answer. It's just
Cool.
not something that is, we've been able to focus on yet. I'm aware of it. I first need law enforcement to present it to us, which could happen with more of a educating our law enforcement agencies, but that is not something that I know, like my colleague in Washtenaw County has been able to focus on because he has a little more time on his hands. But Ellie and I talk all the time, and I think what he's doing is great. I just don't have the resources right now at this moment to focus on that.
What are the resources that has to look like over time?
Probably people, but before we do that, we would need to really understand and get training that provided to law enforcement, which would require educating the public about when to make a police report in that situation.
Okay, understood. Do you interact a lot? The probate court came through, and I believe they said that you have a staff member that helps with conservatorships and like adult guardians. Is that right? Or is that something that you're seeing? Or maybe they said they'd be nice to have. Maybe I'm misremembering.
I
but
think they've said it'd be nice to have. We were
Okay.
contacted before. There's sometimes some overlap
Okay.
in the probate court where they feel there's an issue and would like our input, but that's never been formalized.
Okay.
We don't have anyone dedicated to that right now.
And I'm not sure we have jurisdiction statutorily to even weigh in on that.
Oh, okay.
That's not, unless it's a criminal matter,
Yeah.
the prosecutor doesn't weigh in on that.
Okay. And then the last question, you mentioned wealth-based bail. I've been
I thought of you when I included that.
Good looking out. Thank you.
I looked right
Yeah,
at you.
I saw you. So please wax some pros about it. How's it going?
It's not going well. There's a real challenge getting our district courts, which are a challenging group of people, to all agree on when arraignments will take place. So absent having one dedicated prosecutor all the time available to every district court, and sometimes that would be more than one, because how many district courts? There's 30, no.
We do like 3 judges in some courts. So
Right.
We have to have one for every judge for every day,
Right.
and that's not realistic.
So we don't have those people. But what I would like to see is a district court bench that agrees to conduct virtual arraignments, and then within my warrants division, have a dedicated prosecutor as part of their job. They also will attend arraignments. So that's a start, and we started that pilot project. We have about 3 or 4 district court judges who, A, believe it's very important, and B, are amenable to, the minute you start talking about when they should do certain things, they feel there's a real sense of you don't control my docket, we're too busy, we can't do that, we can't do that. I'm a little less compassionate because I'm a former judge, so it's an issue. But again, that is definitely something on my radar that I just haven't had a chance to tackle. If it were just fixed with resources, I think I would have probably come with you for a solution, but it's not resources, it's getting the district court, which you all know operate as all different funding entities, and we don't have a lot of luck trying to get them all on the same page.
Okay. Does the 36th District Court recent ruling, the Ross 36, do you think that's a good sign? Does it not
I do. I
affect
think
you?
that's
Yeah.
going to, and also Barb Hankey.
Yeah, okay.
She's really going to be instrumental, I think, in moving that forward.
Cool.
This is just something I'm not going to be able to fix at the prosecutor's office. It's going to have to be addressed with district court judges and community corrections and law enforcement all working together.
Okay. Thank you. Yeah.
Okay, Commissioner Powell.
I just wanted to put on record, I know I said this before, but our prosecutor had hosted an expungement fair, and it was housed in Pontiac. And I actually was able to participate in it. with an individual to walk through the whole process, and it was a phenomenal event. And I wanted to just say, if in fact, well, one, I want to ask, are you still planning to continue that? And if there's any barriers you see, I would love for you to bring those before the board, so that something like that I witnessed myself, and I would encourage you all at the next one, please go and just witness it.
It's
But
very
it was
inspiring.
Like
It really
it was
is.
a one-stop shop, and really, all you had to do is mail your paperwork off. Now, my situation was a little different, but I thank Betsy for helping me with some things. But for the most part, I just want us to continue supporting that event. And if you do, are you planning to continue them? And just to encourage you, if you see any barriers, please let the commission know so we know to try to help support it.
Well, one of the things that was really inspiring to me is the amount of assistant prosecutors on a Saturday afternoon who were just volunteering their time to
And
help.
attorneys,
And
right?
attorneys. Well, and from
Oh,
my
they-
office, assistant prosecutors. I was driven there by one of our investigators, and who is ex-law enforcement, retired, and he was a little skeptical of the whole thing. Everything sort of changed, right? And at one point in the fair, I looked over and he was chatting with somebody who I didn't know. And when we got back in the car, he said, you know, there was my friend. And I said, oh, who was he? He said, well, he was the paramedic in Farmington Hills forever. I've known that guy forever. He's amazing. And I said, oh, really? He's like, he had a felony on his record. And it was for something obviously not violent, and his eyes were opened. Like he said, that guy, that conviction, that was 20 years ago, and it was holding him back to do other things. That's who you saw at that fair. And so it is really, really important. We had a lot of help from the county, though, in that, correct?
Yeah, we did partner with.
Yeah, speak up.
We did partner with the county on that event. We do, and we actually have our upcoming resource fair in September. In September.
Right, we have a
September 24th.
racial justice resource fair in another one, our second one in Pontiac, where we continue to educate people. We do not have another expungement fair scheduled, but that's definitely something we're going to be doing.
Oh, the only thing I would suggest is make sure we got bigger printers.
Yes,
That was
definitely.
But people
we've
waited.
highlighted the problem.
They were patient.
They were.
Y'all gave snacks, thank you.
And
'cause
lots of snacks.
People like to eat.
They do.
And I'm telling you, it was amazing. And them people left just feeling like they're hopeful that finally.
Well, it's
'cause that
reimagining-
process can be so conflictual if you do it on your own.
Well, it's reimagining what the prosecutor's role is, right? And I struggle with it too. Traditionally, it's not something a prosecutor's office would do.
No.
But when you step back and think about our number one goal is public safety, and a lot of convictions on people's record, they're preventing them from doing what we want people to be doing, securing housing, employment, being more stable. All of that makes us safer.
So thank you all for that.
Thank you, Commissioner Powell. Anybody else? I just had one question. Somewhere in here, in your material, I was reading about your employees and what they've been through. This has been really a crazy year for the prosecutor's office. So do you have extra mental health support for your staff and everything that they've been going through? Or how are you dealing with that? Because
we don't. And you know, I have to say, a lot of times I get a lot of, I grow a lot just watching what Sheriff Bouchard's he's been doing this so long, and when you look at what he's been able to provide for his office, because he knows how to use outside resources, and you know, he has that for his team. We do not. We had a couple sessions just for our smaller group right after that with the county provided Encompass. But no, we don't have that, and we would. Yeah, I think we could really all benefit because again, you know, we aren't necessarily first responders, but
You're second responders.
We're
you
living
get all
with
the
it.
same
Yeah.
information.
We're
deal
living
with a
it
lot of
with
the
it
same people.
on a daily basis, and it's a really dark place to be. And we're also dealing with sitting down with victims And those relationships that we're forming, they're hard. So we just went to visit the new Resiliency Center in Oxford that, if any of you know about, it's really impressive. They have the new space, dedicated counselors, a nurse, navigators, to provide that kind of care for the community. And I was, at the time, thinking, we really do need something. I mean, we stress a lot these webinars we can go to and talks about well-being, and I focus on it a lot, but no, we don't have anything like that.
Sounds like something for the future that we ought to be thinking about. We just set aside $10 million in ARPA money for mental health for the community, and you people have hard jobs.
Yeah, and I think, at least with the first responders, I think there's a real community and understanding and accepting now that that's a need. But I don't think it's quite made it to our office, even within ourselves. I don't think that's something that we really think about. But I mean, secondary trauma is it's a real thing. I experienced as a judge, and I mean, yeah, we'll never really be the same after that. You know, I don't look at the world in the same way, and I know everybody working closely on the team does not either.
Well, I guess I would want to assure you from the Board of Commissioners that we are open to supporting you in that regard. I mean, we've had a lot of conversations about mental health support across all the committees that we have. So, you know, well, let's not drop the ball. Let's think about.
I'm certainly not,
how
and
we
some
can
of you in the
support
room
you.
know we are about in the next month to announce the creation of a commission that we're forming that is designed to address what recommendations are, not just on these hard measures of, you know, physical safety, but also recognizing, training to people to recognize when someone's in crisis, an anonymous uniform supporting system and network like Sandy Hook, the woman that started the Sandy Hook Promise is also going to sit on it. We have 2 of our commissioners have agreed to sit on this commission, and people from all over the country. I'm really excited about that, and that is one of the things that we could be looking at in a recommendation. Betsy Haig is really leading that up along with Markeisha Washington. So the date is September
19th is our launch date for that. Mm-hmm.
Excellent.
I was hoping I would want to brief the commission on it in a separate meeting.
Excellent. Commissioner Charles is back on with a question.
I just wanted to follow with what you just said, Commissioner Markham, where it struck me that we get those letters from the HR departments. I forget what they're called. The Kyle Jen is there, I see. You know, the people who, like, if you're having trouble at work or if you're just not feeling robust, you could reach out to those folks. I'm just curious, have we maybe upped our subscription to that so that the prosecutor and other departments don't have to dig into their own pockets if the HR department's already paying for this or some level of the service, which I'm sure less than 25% of staff is using anyway. So.
Say it again.
Okay, that's a good point. Good question. Kyle Jen has asked if he could have a couple of minutes at the end here. Did you mean at the end of the prosecutor or just at the end of our meeting? Okay. Well, if we're all finished with the prosecutor's office, thank you very much for coming.
Thank you all so much.
We admire you, and we want to support you in any way we can. And, you know, thank you for all you're doing. I mean, how do we even
I
say
appreciate
that?
it. I mean, we do feel supported, and I meant what I said, that does make such a difference in how we do our job. I don't feel like this is a contentious interaction, and I know in the past it might have been, but I don't feel that way at all, and I think if any good or anything positive has come out of that, it is the really feeling very proud that how we all are really willing to work together when things like that happen. So thank you so much.
Well, thanks very much for coming in today and all the hard work.
Thank you.
That's right. We're ending on time, so you're eating into our time.
Okay, I'll try to keep it to an hour or less then. I just wanted to update the committee on one process thing, and then kind of comment on one theme that's kind of run through these meetings. On the process side, there's normally a list of budget amendments we bring you that are technical in nature, so either kind of cleaning up things that have happened in other resolutions since we put the budget rec out, truing that up, or things that were technical oversights that have been identified. So we will bring that list to you on Thursday. I think in the past, there's been like an updated list that's been brought every week, and I thought, for the sake of streamlining the process, we'd bring the list once and explain it to you, and then you can consider it at your budget wrap-up session next week. The second thing, I just wanted to, there's been a theme that's run through some of these hearings in terms of technology and facility deficits. I just want to assure the committee that the county executive administration is acutely aware, that we do have substantial needs in the facility and IT areas. On the IT side, you heard the prosecutor just now that project is moving through our process. We've included now in the budget the last 2 years a pool of funding that can be accessed, for the IT projects that rise to the top of the list in terms of criticality. The circuit court case, so that's a project with at least a 12-year history on it, that we're addressing, in a pretty time-effective way, I think, here. The circuit court case management system, that's a system that's 40 years old. The RFP was funded by you in the current budget and is getting rolling. That's going to take multiple years to address. And on the facility side, we've also got, we're making up for years of underinvestment here. The building we're in right now is 60 years old, clearly, has not been invested in to keep it up to standards. And as I've mentioned previously, we've got Plant Moran doing the assessment of our full campus facility needs. That's 45 buildings. We are working through those details with them even this week in terms of understanding the numbers. I mean, we're going to end up with a number here that I think approaches $1 billion in terms of potential facility spending. So we are certainly a healthy county in terms of our finances, but we want to make sure we continue to be a healthy county in terms of our finances, and we know we're going to have to do this. It's a problem that's built up over decades. It's a problem we're going to have to address over at least a decade, and we want to make sure, that we work with you to prioritize, that we do things in a strategic way, that we don't invest money to address a facility issue here in a space that can, potentially be consolidated down the road. So, I don't want to sound like I'm just punting, but I want you to know we're taking active steps on all of this. We recognize the size of the problem, and we're going to work to, start bringing you the first steps, in a plan to address all of this in a financially responsible and sustainable manner. So just kind of wanted to add that context, as I've sat through these hearings and heard that theme.
I think one of the things that has stood out to me that facilities-wise is with all these paper records, and we don't even have fire suppression in some of the areas where we're storing the paper records, that's got to change. I mean, I'm not willing to wait 3 or 4 years. Either we need to put in fire suppression, or I don't know.
Right.
I think that's a very acute
has heard
problem.
that message. We brought you the project, on the evidence storage under the jail, to renovate space in another building because of the flooding issues there. So we recognize those are the things, that have to be at the top of the list.
Okay.
Absolutely.
Good. Commissioner Powell?
Well, I'm just gonna say for the record, thank you, because I was over here squirming in this little chair, like, wait a minute, I know they know about this, so what is we about to do across the street? So
Right.
thank you so much for
Well,
giving
don't thank
that.
me yet, but we are working
I
on it.
think we all get it though, right? And I'm just happy that you're transparent, at least letting us know where we're at right now. And because of my squirming today, thank you very much. I feel a lot better. Thank you.
Thank you.
Thank you for your time.
Thank you, Kyle. If nobody else has anything else they want to bring before us, I guess I will open public comment. If there's anybody from the public who cares to address us. Seeing no one here or on the screen, I will close public comment. If there's no other business today, I will call this meeting adjourned at 4:55.
Thank you.
5 minutes early?
Bye.